All right, good morning. I'm calling this roundtable to order. Today is Tuesday, July 2nd, 2024. The time is 8:35 a.m. I'm at-large Councilmember Christina Henderson, Chair of the Committee on Health. Today, we're holding this roundtable jointly with the Committee on Housing to hear from public and the executive regarding continued challenges district residents are experiencing with enrollment for health and human services benefits through the DC Access System, or DCAST, or also known as District Direct. As we discussed in December at the roundtable, the goals of the DCAST project are certainly laudable. The system came out of the Affordable Care Act, and it was intended to create a streamlined, integrated, efficient system to connect district residents with health and human services. Through a single portal, residents should be able to input their information once and have that data fed through the eligibility determination process for each health and human service benefit the district offers. DCAS is also supposed to collect information from existing databases like tax records to eliminate the need for residents to repeatedly submit the same data. However, federal requirements for data verification processes have limited the extent to which DCAS has been able to effectively streamline the application process. As we discussed, DCAS is an expensive system. In FY25 alone, DCAS is budgeted to cost over $77 million. We continue to invest massively in the system and yet are not seeing the major improvements. This is a follow-up oversight roundtable to the December 2023 roundtable on this same topic. The Committee on Health has also held 3 previous oversight roundtables on Medicaid renewals and redeterminations following the COVID-19 public health emergency. At all of these roundtables, the executive has testified to their efforts to improve the DCAS system, and we intend to follow up on the effectiveness of those efforts and press the agencies on the continued system challenges today. To start, I'm pleased to note some improvements since the December roundtable. The district has made significant improvement on the timely processing of SNAP applications. Since our last hearing in December, our SNAP timely processing rate has increased from 42.9% in October of 2023 to 73% in May of 2024. That said, we are still well under our pre-COVID rate of 93.9% and our federal goal of 95%. The continued struggle of timely application processing has real implications for district residents who are awaiting the eligibility determination and benefits. Unfortunately, other metrics show DCAS is not making the improvements promised by the executive. The USDA recently notified the district that it will now be subject to a financial penalty for exceeding the payment error rate, or the PER, for 2 years in a row. The district's PER in 2023 was 20.3%, an increase from 19% in 2022, both well over the national average of 11.9%. I just want to let people know, so the payment error rate is a calculation of overpayments and underpayments of SNAP benefits. The district case and procedural error rate, or CAPER, was also significantly higher than the national average in 2023 at 53.7% compared to 44.1%. Although the executive has ascribed these error rates to the increased burden of new programs like pandemic EBT and emergency allotments, these programs are not unique to the district and thus should not be putting the district's error rates well above other states and jurisdictions. Data on pending non-passive Medicaid renewal applications also indicate a troubling trend. As of June 27th, 79% of pending applications representing 13,000 people have been pending for over 90 days, a significant increase from the 27% of renewals that had been pending for over 90 days in November of 2023. Although residents are supposed to maintain coverage while their applications are pending, we have had testimony at previous roundtables that that does not always happen and that pending renewals can create confusion for beneficiaries and the agencies. This is a co-chaired hearing. Councilmember Robert White had a family matter. He's on his way. And so I'll turn to him for opening remarks when he arrives. We let the folks know who has signed up to testify that due to a scheduling will be due to external scheduling demands, we will be flipping our public witnesses and executive witness. However, we do have one public witness who will need to go first. And so I will call that person up now. So Miguel Fernandez Bernal. Oh, yeah. Okay. Mr. Bernal, if you just hang on for a second, we're going to turn to Councilmember Robert White for his opening statement.
Good morning. I want to thank Councilmember Henderson for chairing this important follow-up hearing on the DCAS system, which allows residents to apply for public benefits like SNAP, TANF, and Medicaid. Since our last round in December, my committee has been following up in hearings with DHS on issues with our public benefit system, and this is a timely opportunity to continue that oversight. Unfortunately, district residents have long been plagued by inadequate, error-ridden, over-budget, and underperforming technology systems. Just yesterday, residents trying to apply for emergency rental assistance saw their applications time out or anticipated wait times of more than a day because of lack of capacity. That means people potentially missing work, family obligations, or healthcare to have some chance that they can get help paying rent. Today, we're having another hearing on DCAS, which the district has spent hundreds of millions of dollars to develop, but which we continue to hear is plagued by errors in either the system itself or its implementation. And bugs in the program or gaps in training or staff aren't just an inconvenience. The real world consequences is that families can go for months without money they are entitled to receive for food or housing. They face desperate situations without any clear timeline or path to support. They often have to file a complaint, rely on legal advocates, go to the Office of Administrative Hearings, and even get rulings in their favor, and still they wait to get their benefits restarted. This is trauma and deprivation inflicted by our government on our lowest income families, whether intended or not. We were just told within the last few days that the federal government has now assessed a financial penalty against the district because of error rates for SNAP have remained too high for too long. So the federal government is out of patience, just like residents. Later today, I want to understand the impacts of that penalty. We also know that while DHS has made substantial progress in timelines and managing SNAP applications, it seems that progress has stalled for the last several months while we are still operating slower than federal standards. We have to figure out what our roadblocks are and what we are going to do to push through them. A city with the amount of resources we have, a city as progressive as we are, should not be among the worst in the country processing public benefits. And we certainly shouldn't be among the worst after spending hundreds of millions of dollars on technology to fix the problem. I know a lot has been done since the last roundtable on this topic, and I want to hear about that today, but we also have to understand that we must do better, both to meet the needs of our residents and to follow federal law. I look forward to hearing about how we're going to get there, and I want to thank our public witnesses and our government witnesses for being with us today. Thank you, Chairperson Henderson.
Thank you. All right, Mr. Bernal.
Muy buenos días, concejales Anderson y Guay, miembros y personal del Comité de Salud. Mi nombre es Miguel Fernández Bernal y soy paciente de la Clínica del Pueblo. Soy residente del Distrito de Columbia desde el 2009 y vivo en el Distrito número 4. Tengo el programa de la Alianza hace alrededor de 12 años y soy de El Salvador. El seguro de la Alianza ha sido muy importante para mi salud. Lo uso para ir a mis chequeos médicos y para pagar mis medicinas. En la farmacia tengo problemas cardíacos, de colesterol y depresión. Y gracias a la Alianza he podido recibir la atención médica y los medicamentos que necesito para cuidarme.
Good morning, Chairperson Henderson, Councilmember Robert White Jr., Council members, and Council staff. My name is Miguel Fernandez Bernal, and I am a patient of La Clínica del Pueblo. I have been a resident of the District of Columbia since 2009, and I live in Ward 4. I've been part of the DC Alliance program for about 12 years, and I'm from El Salvador. Having access to DC Alliance health insurance has been very important for my health. I use it for my medical checkups and to pay for my medications at the pharmacy. I have cardiovascular, cholesterol, and blood pressure conditions. And thanks to DC Alliance, I can receive the medical attention and medications I need to manage these conditions.
Hoy estoy dando testimonio porque mi servicio de la Alianza no ha funcionado desde agosto del 2023. Y después de meses de llamar, escribir e ir presencialmente a las oficinas de AH, no he podido obtener una solución y me siento desesperado. Desde agosto del 2023 que estoy y sin servicio de mi seguro de la Alianza y sin explicación o resolución de por qué esto está pasando. Cuando me di cuenta de que no funcionaba mi servicio de Alianza, fui a la oficina de AH en la Taylor Street para ver qué pasaba. En la oficina de AH me dijeron de que no había ningún problema con mi seguro y me dieron una hoja que decía que mi seguro estaba activo hasta el 2025.
Today, I am giving testimony because my DC Alliance healthcare has not worked since August of 2023. And after months of calling, writing, and going in person to the DHS office, I have not been able to obtain a solution and I am feeling desperate. Since August of 2023, I have been without my DC Alliance health insurance coverage and without an explanation as to why this is happening or how to fix it. When I realized that my DC health insurance wasn't working, I went to the DHS office on Taylor Street to see what was happening. In the DHS office, they told me that there was nothing wrong with my insurance, and they gave me a paper that said my insurance was active until 2025.
Mis turnos médicos se seguían cancelando. Llamé a las oficinas de H y nadie me atendía el teléfono. Después de muchas llamadas, alguien de la H por fin me contestó y me sugirió que volviera a aplicar. Mandé mi aplicación nuevamente y sigo sin ninguna respuesta. Fui a la clínica del pueblo para ver si me podían ayudar con este problema. Un especialista de beneficios en la clínica intentó de ayudarme escribiéndoles a la oficina de H por correo electrónico para que le den la información sobre qué pasaba con mi seguro. Él ha escrito una vez por mes desde enero del 2024 y cuando contestan siempre dicen que no saben nada sobre mi aplicación, pero van a solicitar una actualización sobre mi caso. Sin embargo, nunca he recibido ninguna respuesta.
My medical appointments continued to get canceled. I called the DHS office and no one would pick up the phone. After many calls, someone from DHS finally picked up and suggested that I apply again. I sent in my application again and have yet to receive a response. I went to La Clínica del Pueblo to see if they could help me with this problem. An intake and benefits specialist at La Clínica tried to help me, writing emails to the DHS office asking for more information about the status of my insurance. He has written them emails once a month since January 2024. And when they respond, they always say that they don't know anything about my application, but they will ask for an update on my case. However, I never receive a response.
En estos 11 meses que estoy viviendo sin seguro médico, se me han cancelado 3 citas con mi cardiólogo. No puedo ir a un examen para una hernia que tengo en el esófago porque no tengo forma de pagarlo. No tengo dinero para pagar mis medicinas para la presión y el colesterol. Tengo miedo de que mis condiciones médicas empeoren, ya que no puedo obtener el cuidado médico que necesito. Quisiera pedirles hoy que tengan en cuenta que cuando hay ineficiencias con DH, nuestra salud se ve perjudicada. Y mi caso es un solo ejemplo de muchas personas que hoy pasan por la misma situación que yo. Hoy les pido que nos ayuden con DH, que mejoren su sistema para poder ayudarnos en eficiente y de buena calidad. Muchas gracias por su atención prestada.
In these 2 months that I have been living without health insurance, I have had 3 appointments canceled with my cardiologist. I am unable to have my examination for a hernia in my esophagus because I don't have a way to pay for it. I don't have enough money to pay for my blood pressure and cholesterol medications. I worry that my medical condition will worsen without the medical care I need in the time frame I need it. I want to ask you today to consider whether there are inefficiencies with DHS or health suffers. My case is just one example of many who have gone through the same. So today I ask you to help us ensure DHS improves its systems to give efficient and high quality support. Thank you very much for your attention.
Thank you, Mr. Bernal. I'm deeply sorry that you've been having these challenges and that they've been persisting since August of last year. When's the last time you spoke with someone from DHS?
Hace 8 días.
8 days ago,
And at that point, what did they say that your case was fine or that they would look into it?
No, que no sabía nada.
they were oblivious. They didn't know anything.
About the new application?
Sí, solo la nueva. Sí.
Yes, regarding the new application.
Okay. Well, folks are here from DHS as well as Department of Healthcare Finance. And so we could try to, hopefully someone from their team can follow up and we can get you an answer today. They're right there.
Okay. Okay.
Okay.
Thank you.
Councilmember White, sorry.
Thank you, Chairperson Henderson. Mr. Bernal, first of all, I'm at a loss for words after your testimony. Most of us don't take lightly the need or importance of going to the doctors, addressing medical issues. And as you said in your testimony, when you don't address them, they get worse. And that will create a real fear, I think, consciously or unconsciously, that we have to deal with. So we are talking about technology systems and government programs, but at the end of the day, what we can't forget is what was in your testimony, what happens to real people when they can't access care, and not knowing for almost a year now when you will be covered again. So I am truly sorry that this has happened to you. And I know that this is one testimony we're hearing today, but it represents a lot of people's stories that we're not hearing. And I hope highlights the critical importance of this program and this hearing. So thank you for being with us. Two just follow-ups. Do you know what number you called when you were trying to reach out to DHS so that we can figure out what's happening with people not getting a response?
¿Quieres saber el número?
So you'd like to know the number?
If you happen to know it.
Yes, that number is 202-727-5355.
Thank you. We will check on that. And if you would also forward to, if you're comfortable with it, the Health Committee, and we will get it from them, some of the emails that you have sent to Department of Human Services and some of their responses. You don't have to, but if you're comfortable, it would help us.
O sea, que ni eso no me han enviado. Ellos no me han enviado correos.
Oh, so they have not sent me any emails.
Okay, well then just the ones you've sent would be helpful.
Nomás solo por cuando ellos me contestan nomás.
Yeah, it's just when they reply to me.
We'll follow up. Thank you so much for being with us. Thank you, Chairperson Henderson.
Great. Thank you so much, Mr. Bernal.
Thank you.
Again, so we have the folks over here from DHS and Healthcare Finance. Someone will follow up with you before you leave. Okay, thank you. All right. So now we're going to turn to our government witnesses. Laura Zeilinger, who's the Director of the Department of Human Services, and Wayne Turnage, who is the Director of the Department of Healthcare Finance, as well as the Deputy Mayor for Health and Human Services. Okay, all right. Before we get started, I'll ask that everyone on, all of you fine folks at the table, as well as anyone from your teams who might speak today, they need to be sworn in. So if you raise your right hand. Raise your right hand. There you go. I was like, no, she'd had a decast. Hold up. Okay, do you swear or affirm under penalty of law that the testimony you're about to provide to the Council of the District of Columbia in this committee is the truth, the whole truth, and nothing but the truth? Great. Director Zeilinger, are you starting or who? I don't know who has the opening statement. Oh, if you would turn your mic on.
We did not prepare a detailed testimony. We have our slides and our notes. We came prepared to answer any questions that you might have. My
Okay.
general comment on the system is that DCAS has processed over, on the Medicaid side, over 300,000 applications or renewals. We have about 80% of the persons who are subject to an application or renewal to have been either been approved for continuing coverage or their case is pending. When they're pending, they do not lose coverage. We have extended on a number of occasions the deadline for responding to a request made by staff or the system so that people would not lose coverage. We have done that on, Melissa can tell you, I'm not sure how many times, but we've done that on a number of occasions. There are challenges with the system, but I can tell you that if you look at the overall performance of the system, I think we have done fairly well. When we find cases where there are problems, I ask that they be brought to my attention, particularly if it's a Medicaid problem. Even if it's a SNAP problem, then my staff will direct that problem to DHS with the expectation and the email from me or my staff that it be resolved before the close of business. I have done numerous cases where people were stuck in the system and we resolved them within a day or two. If we are looking for perfection, not going to get it. And it doesn't diminish the importance of what we do. But when you have a system that is a very expensive system, you have complicated eligibility rules, mistakes will happen. And so all we can endeavor to do is when a mistake happens is to fix it post haste. And that is what we do. But I stand on the overall performance of the system. I think when you look at the number of people who are on Medicaid, we cover half of the city with insurance benefits, half. And I don't get a ton of complaints about people not having access to coverage. Are there problems? Yes, and we work on those problems. The more challenging group is our non-Magi group because their applications are more complicated. If they're coming into the system for the first time, they have to fill out an extensive application to bring data into the new system that the old system had, but the new system did not. But we work with those cases as well, and they have benefited from several extensions. So we do what we have to do to keep people from losing coverage who are continuously eligible for coverage. That said, sometimes people lose coverage because they're no longer eligible. During the pandemic, we didn't take anybody off. No states did. We were told not to. Some of those people have earnings that kick them off the system. And sometimes we get complaints about people not having access to Medicaid, and then we do the income check and we say your income is over the limit. So, that is just a general summary of how we approach this process. And again, I think, even with some of the challenges that we face, some of the challenges on the SNAP side, the high error rate, high is, in this case, 20%. A lot of states are experiencing the same problem. But that means 80% of the payments, the payments that are made are not in error. So the system is not tremendously flawed. It is not perfect, but it is doing a lot because a lot is being asked of it. And then when you intermingle the demands the system places on staff, and sometimes staff have to be trained, and sometimes staff make mistakes because they may not necessarily understand every aspect of the new system. We work on those issues daily. So those are my comments, and we are certainly available for any questions.
Okay. Thank you, Director Turnage. We'll do 10 minutes rounds if that's okay, Councilmember White. Director, I want to start, I guess, sort of a follow-up of some of the conversations we had specifically about the DCAS system in December. So at the December roundtable, you all testified that you were in the process of onboarding a new vendor to increase customer experience. Was this new vendor successfully onboarded? Oh, if you could just state your name for the record.
Good morning. My name is Melissa Bird, I'm Medicaid Director of the Department of Healthcare Finance. I think you're referring to bringing on Code for America, who has been working with both the Department of Human Services and the Department of Healthcare Finance. That work is ongoing. I'm happy to ask Ms. DeWitt to come up to speak in more detail, but their initial findings on the application itself were not as many corrections, if you will, or improvements that they recommended at the time, but it's an ongoing process at this point.
Okay. In November 2023 corrective action plan submitted to FNS, DCAS reported that it was planning to implement a system upgrade that would reduce clicks for workflows, reducing the amount of time it takes to process a SNAP application. This upgrade was projected to be implemented by March of 2024. Was this completed?
It's scheduled for later this month. We're still training staff on the upgraded system before we implement it.
Okay, so it's not currently live. When do we anticipate that it will be live?
Later this month.
Later in July?
Yeah.
Okay. What was the delay?
The delay was just getting the funding and getting the procurement in place.
Okay. If you could just introduce yourself for the
Sorry.
record.
Tamika DeWitt, Director for DCAS.
All right. Healthcare finance indicated in FY 25 during our budget hearing season, in your pre-hearing responses that starting in 2025, CMS will no longer fully fund critical interfaces on the Federal Data Services Hub, and that to continue validating residents' information seamlessly, DCAS is going to need to fund these services. Do you expect this to continue seamlessly?
Yes,
Okay. And that funding was accounted for in FY 25 budget?
yes.
Okay. Right. Director Turnage, during the December 2023 roundtable and during the FY 25 budget oversight process, you testified that there were technological and programming updates to be made to DCAS this summer, including an update to the QRM technology. Is this the same as the workflow upgrade, or is this something different?
There are a number of upgrades that have that we characterized under the summer 2024 updates. Tamika can describe them, and some of them are in process, some of them are finished.
Yes. So the main portion of that is the QRM upgrade that is going live on July 7th. That will assist with caseworker usability. We also do regular technical performance updates in the system now that we started since last year, and we've seen a significant impact to the system not timing out, it allowing the caseworker to seamlessly move through the application, whereas previously we were having issues on that.
Okay. We discussed the possibility of user testing to look at what's working and what's not. Is that something that we're going to embed in this process?
We do user testing with our business partners. I think specifically we were talking about bringing in the public for some of our major implementations.
Yeah.
And yes, we will be utilizing that method as we work with Code for America. They've had some focus groups already that have brought in the public to get the information in so that we can determine where we need to focus our areas for our application usability concerns. And so as we move forward with determining what we will work on as a project, we will then bring in the public again.
Okay, so what's the feedback loop? If it's DHS staff who are mainly using the product, do they have an opportunity to say, hey, if it did it this way, it would make our job 10 times easier? And then like, I think a lot of these conversations that we have about DCAS is like, is it the system or is it the person using the system? But the persons using the system, I feel like can be the experts in sort of the difficulty pieces.
Yes, we do have a partnership. We work in collaboration on our projects and the work that we're doing, our ongoing operations. We have strengthened this relationship over the past year and a half since I've been the director. And so there's major input. We have actually, one of our strategies that we're working on is to fund additional resources for DHS so that they can, that speaks specifically to the system so that we can have kind of interpreter, from policy to technical resources that can give us the information that we need in the way that it aligns with DHS's operations, and so that we can implement that in the system. We do feel that that has been an issue in the past, and we're working together on that to mitigate the issue.
Okay. One last sort of update question on the system. We discussed during the budget hearing in April that DCAS will onboard a new operations and maintenance vendor this summer/fall. How is that procurement going?
Which you can share. Procurement is ongoing.
Okay,
I
just want to make sure you started.
Oh, yes, we've started, and there have been significant progress. We expect a timely conclusion.
Okay.
We hope to be bringing on a vendor soon.
Okay. All right, so let's turn to talking a little bit about Medicaid. So in the pre-hearing responses, Healthcare Finance shared that as of May 2024, for Medicaid renewal applications, 79% of the beneficiaries, about 13,000 individuals who have non-passive renewal, so non-magi, have been pending for more than 90 days. And 9%, it's about 1,500 folks, have been pending between 60 and 90 days.
Yes.
To confirm, would this suggest that only 12% of non-passive renewals are being completed in a timely manner? Or less than 90 days?
You promised no math, so I'm not going to.
Mm.
So look, the challenge we have for a small small but significant percentage of cases is a long time period from the date that application or renewal starts till it is approved. So that time that they are stuck in pending is significant, and it is unacceptable. Now, why are they stuck in pending? There can be two primary reasons. One is caseworker driven. We have a lot of staff, but we have a lot of caseload, and sometimes the work that they have to contend with runs in front of their ability to resolve things efficiently and quickly. But the other problem is, and this is related to the issues that the caseworkers have, is we don't get timely responses to information that we request all the time. In other words, and it's not, I'm not criticizing the applicant, because particularly on the non-magi side, it is a very complicated application process. You got to look at assets. There could be spin down involved. This is very complicated. And then you're dealing with a population, that may not understand the rules, because sometimes, if you're a layperson, it's going to be very difficult to swallow and understand the arcane Medicaid rules.
Well, so let me ask you this in seconds. I have about a minute left on this round. What level of triage is happening? So I've learned from dealing with DC Health in terms of the boards is that, yes, the person might have submitted the application, but it might have taken somebody on DC Health side 30 days before they even opened it to determine whether or not something was missing. And so are we looking, does the DCAS system allow for you all as the administrators and managers to check to see, has anyone even touched that application, or is it sitting awaiting for someone to look at it?
Well, I am fairly certain that you can look in the system and see if an application has been sitting. We do triage. For example, you will see progress on the SNAP and TANF side. That's because we prioritize those cases.
Okay, so
and-
of the
and then-
13,
And then, but when you squeeze a bubble in one place, the pressure pops out in another place. So when we prioritize TANF and SNAP and we get good progress, and it's important, you might see a uptick in the number of pending cases on the Medicaid side.
right, but all three of them have penalties on the
Well-
federal side if we don't do our part.
Well, on the Medicaid side, we get extensions, and we have been successful in getting extensions. We're not facing any penalty, as I understand it, from this process. Again, we rank second in the country. I'm saying that real slow. We rank second in the country for cases that have been renewed successfully from March of last year to May of this year. That's second in the country. We've terminated just 7% of over 300,000 people who have applied, and we have approved 77%. So, yeah, we have issues, but we're not, we're not dragging up the end.
Okay, but I don't want to compare ourselves to
But we're second in the country.
yes, but for the
Okay.
13,000 people who are waiting, they could care less.
Right, but but they're not losing coverage.
Some of them.
No,
I'm over my
and
time.
And if they lose coverage, I tell my staff to make sure if they call me, they're gonna have to deal with that day. Because when I get that email or I get that phone call and I give my number out freely, I give my email out freely. And I tell people, if you have problems with the system, call me. And they do. And I tell my staff, I tell Eugene, I tell Melissa, I tell Melanie, I want an answer to this by close of business tomorrow. And then I tell the person who called me, if you don't hear from my staff, call me again tomorrow. And that's the way it works when we have cases that bubble up that somehow slip through the system.
Councilmember White.
Thank you, Deputy Mayor, Director, and to the rest of your team. Director Zeilinger, this roundtable is timely because just a few days ago, you notified us that DC's error rate for SNAP payments has now been high enough for 2 consecutive years that the federal government is charging us a financial penalty. You were supposed to learn the amount of that penalty at the end of last week. How much was that penalty?
So that we did receive the letter on Friday. The amount of the penalty, I believe we also provide you a copy. The letter is $4 million, about $4 million. And we are able to reinvest 50% of that. We can either pay the penalty, appeal, if we believe it's not accurate, or reinvest half of that in improvements to our case processing, to the program and new initiatives. We intend to develop a reinvestment plan that is subject to approval by FNS.
Okay, so we don't plan to appeal it.
No,
DC, I believe, was fined along with 11 states. Is that right?
that's correct.
Okay, so that puts us about in the bottom 20% of performance. Where's the money coming from to pay the penalty?
The money will be working with the budget office on a reprogramming.
Will it be reprogrammed from within DHS?
I don't believe so.
Why don't you believe so?
We don't have the funding in DHS for that. But we will be looking to the budget office will be looking to do it through the city's budget.
And we were penalized because our error rate was above the federal standard of 6%. What is the error rate right now for DC?
We don't have an official error rate right now. It gets published annually. The number that you referred to is from 2023. We do look at that constantly through our own data. We know that we're still not where we would like to be. We have first and foremost made our priority on improving our timeliness. We all talked about the importance that people need their benefits as soon as possible, and that has been all of our activities since we've been together and since we've struggled with keeping up with our caseloads have been about getting benefits out first. That has been our number one goal, and we have seen remarkable improvement since we were together last. We're almost at 80% in terms of our timeliness rate at this point. Our payment error rate is lagging behind that, but we have a set of corrective actions in place around our training and our people, around the technology improvements that we're here to talk about today, as well as changes to our business process and staff-wide summits that we believe are going
I'll
to
get to
improve on
the,
that.
what we're gonna do going forward in a
Okay.
moment. What's our most recent error rate that we know?
It's still just under 20%.
Okay, and you said we're not where we would like to be now.
Right.
But so do you know what the current error rate is?
It is just under 20%.
Okay, so that's the current one.
Yeah.
Okay. How many years has our error rate been above 6%?
Well, there was, during COVID, there was no reporting on the payment error rate. So there were a number of years that we did not report that data. I can get you that 1 second. Let me just.
While you look for that, so our error rate is about 20%. Deputy Mayor, you and your testimony that you presented, I don't have it in writing, but I wrote it down, I think accurately. You said we're doing fairly well. That's correct?
Yes.
Okay, by what standard are you using to determine that an error rate of about 20% is doing fairly well?
I don't focus just on one element of the system. The system is, we deal with a lot of issues. We deal with Medicaid, we deal with SNAP, we deal with
What do
TANF.
you focus on to
I
determine?
focus on the totality of what we process, and I look at every element. And if every element is struggling, then I wouldn't say we're doing fair.
But specifically, what do you look at
I
when you
look at,
determine?
well, probably because of there's an inherent bias. I focus on Medicaid because I'm the DHCF director. I rely on Laura to tell me when there are problems with SNAP and TANF, and she does that. So I think when you look at what we do on the Medicaid side, when you look at what we do on the SNAP and TANF side, when you look at the volume of cases that we handle, I think we're doing fairly well.
So your
Does-
testimony was about the Medicaid side?
My testimony about the system as a whole.
Okay. Director Zeilinger, do you agree that we're doing fairly well?
Bless you. Do I agree we're doing fairly well on what exactly? I believe, look, our goal is always to process our benefits accurately and timely. So we're doing the best we can with what we have, and we continue to do everything within our power to do better, to reach that goal.
Okay. Where we are right now, is that the best we can do?
We have a clear plan of what we're doing to improve, and we've done everything we possibly can. I think it is really important to understand the context, sir, in which we're operating. So during the pandemic, our caseloads increased by over 40%. We still have very high caseloads, and all of the administrative flexibilities that were present during COVID have pretty much expired or expiring within the next few months. We also have onboarded and trained a lot of brand new staff. And we continue to improve our system that right now has a lot of complex manual steps and things that require a high level of training and vigilance to a set of processes. And we continue to make that system better for staff and for people who are applying online. So our workload volume is never been higher, and we are doing everything we possibly can to continue to improve to meet our goals around accuracy and timely and accessible benefits for our residents. And we will continue to do everything we can within our power to achieve that.
Not being perfect is understandable. Even being well below where you want to be is understandable. What I want to make sure we understand today is there a clear understanding of what's wrong, and is there a clear, viable path to getting to good performance?
So, sorry.
So
Yeah.
let me start with what's
Let me-
wrong. What are the specific reasons our
Right.
error rate is where it is?
Do you want me to speak to the reasons, or you want to go?
I'm starting and you can clean me up. There are a number of known issues with ESA processing. I asked my team to put those issues in buckets. Is it a caseworker issue or is it a systems issue? And I said, so for each problem that we have identified, put it in a bucket and then tell me what solutions we have executed or in the process of executing to fix it. On the issue of system time out and latency, which can affect ESA processing, can affect timeliness. That is a system-driven issue. And we've executed a number of fixes to address that problem. I won't get into the details. You can ask Tamika about them, what they actually do, but we are making system changes to deal with timeout issues. There are notice problems, and that's a function of both caseworkers and the system. The notice problems occur when there's an inaccurate triggering of notices or when there's an inaccurate notice content. And so we have taken steps to fix that by hiring business analysts to support a new business process to help us bring that problem to closure. Then there's a general usability problem where the system and the operations are not necessarily aligned in many cases in the way that it should. And sometimes the system has been determined to be not intuitive and it has too many pages that caseworkers have to work through. And so we have taken steps to address that. And then there's training. We do lots of training, virtual labs, in-person support to address some of the issues that we feel are a function of caseworkers needing to be more up to speed on how the system works. And then there's the payment error rate. We believe that is caseworker related. And I will let Laura talk specifically about that particular.
Okay, so
challenge.
you're telling me mostly about symptoms and I'm trying to understand the causes. Now I'm out of time, but I'm gonna come back to this. So issues with usability, issues with timeouts and lateness, that's how things show up. What I wanna understand is what is causing those issues.
Yeah.
Okay,
Sure.
so let's start there when I come back. Thank you. Well,
Thank you, Councilmember White. Director Zeilinger, when we're flagged for either overpayment or underpayment, does FNS provide details in terms of which specific beneficiaries are either ineligible in receiving funds or were eligible and are receiving less than so that you all can make the adjustment?
So we actually have a separate, in our Office of Program Review and Monitoring Integrity, we have a sort of firewall between the quality, the unit that does the review and reports those review of the cases. We also now have, once they finish that, a feedback loop between that group and the group that does training and our teams that do processing, so that we're going back and able to get to what are the common errors, how is the QC team understanding those errors, and how do we use that to have more of a continuous improvement methodology within the agency.
Right, that's overall, but I'm talking about, let's say if I'm receiving benefits, I have been getting more than I've been supposed to be getting. At some point, is somebody going to go back into the system and
Yes.
adjust my number?
Yes.
Okay. Let's talk about staffing. And this kind of cuts across both. And I have to ask this question because, you know, all of the systems are kind of going through. So in December 23, DHS testified that the agency has 186 SSRs on average processing eligibility applications at any given time. How many are we at now?
We have 333 SSRs, 288 are processing cases in the queue. The balance work on escalation cases or other specialized eligibility functions.
So 288 working on processing.
Correct.
Okay. How many of those are technically still in training?
We have a brand new cohort who we just hired, that included 19 new SSRs who are in training. We have two cohorts in cohort 9, cohort 10 are in training.
Oh, if you could turn your mic on.
I'm sorry, Brian Campbell with ESA. The most recent cohort we brought in is cohort 15. And so those are just starting training. There's 16 folks there. A couple others who have not completed all the way through, but rather we train in sequence. And so we might not be trained in all programs. So we can bring people on board.
Okay.
So they're-
My question is of the 288, how many of those are actively able to work on cases independently? Or
Oh.
does your 288 number include those who are also still in training?
No, it subtracts 16.
Okay. All right. How many vacancies do you have left?
We have just a very small number of funded vacancies, as I believe you're aware. A number of positions were swept by the council during the budget process, and some of them were filled positions. So we're in the process of reconciling how many funded vacancies we have left so that we don't have to lay off staff and seat.
Okay. At the December 2023 hearing, DHS testified that each SSR was completing on average 5.5 case actions per day. Where are we at now?
So I will tell you. I mean, so I think it's important to understand the types of case actions that we do because they're not all the same. We do brand new applications, which take longer than a mid-cert, which is a 6-month verification of things being the same, or if they're reporting any changes, a recertification for benefits or a change in circumstances. Those each have their own time frames, and I'll give that to you in 1 second. So I'm going to tell you we've seen improvement over time. Because I noted earlier, we have a lot of new staff and it takes a while for them. So our average time for SNAP application in fiscal year 24 has been 74 minutes. In May, it was 66 minutes. For a mid-certification, or that 6-month recertification, it's 32 minutes, the average being 35. That was mid-cert recertification being 45 minutes in the month of May, 53 minutes on average. I could go on.
I'm
to
sorry,
do
can you
each-
break down that sort of metric? When you say SNAP application 74 minutes, what do you mean by that? 74 minutes they're spending
What
on?
has been the average time in this fiscal year to process a new application for SNAP?
74 minutes. Okay.
74 minutes. Yeah, and we are seeing, and when we look over time since fiscal year 23, we see improvement. So we're seeing improvement over time.
Okay.
And those numbers come down, and those are due to all of the things that around both systems improvements as well as improved staff being more adept in the system that they're using.
Okay.
And for every single program and every single type of action, I could give you the
I'd be
minutes
interested
if
in
you would like.
knowing that, because I think the last time we talked about this, you testified that one of the major challenges to timely SNAP application processing is the need for a significant amount of manual data entry. And I'm trying to understand that because we have a system. Now, I know that people can submit paper applications as well. But I imagine that the vast majority of people who are applying are going through the district direct portal. Yes?
Yes.
Okay, so I'm trying to understand, is the data entry around corrections, or is the data entry of the paper applications?
There's still a significant amount of work. It's not you just enter information, hit a button, and an eligibility determination comes out. So there's a fair amount of work that somebody does in the system in order to process eligibility for an application. They also need to type a case narrative to describe what they did, whether it's a change in the case or what have you. And so it's not, I think it would be, there is no system where one just types in their information and it spits out a determination.
Okay.
The worker then also needs to go between multiple systems to verify evidences and to input specific information.
But no one is doing a hand calculation of the amounts, are they?
They have to, not usually, but there are things, for example, for the SNAP program, you have to look at shelter deduction. So you need to look at how much is somebody paying for their rent, how much are they paying, what is the utility allowance, and what is the ratio between that and their income. And it's it's complex. The other thing to be aware of as well is right now we've had a waiver for interviews, which means that often there's incomplete information that comes in. So worker does not have everything that they need to process, and they need to reach out to the applicant to fill in those blanks. On the flip side of that is that that interview waiver goes away in October, and we will be required to do interviews again at initial application recertification for SNAP,
Okay.
which will add some additional time to the process,
And when
but it
does that
also will
start?
help our accuracy. October.
October. Okay. Now, I'm gathering from, even when we talked about this during the DHS budget hearing, that you all are using a significant amount of overtime to try to catch up.
Yes.
How much have we spent in overtime this far this year?
I do not have the specific amount in front of me of how much we're spending in overtime, but almost every single Saturday, we have a team of staff who are on site processing cases through overtime. We also have policy people and help desk folks, and we've seen that a very effective way for people to increase their efficiency in the system, to not pend cases because they can work through any issues, get answers to questions on the spot without a waiting room of people or customers in front of them. And we've been able to use overtime strategically. I do not see that, given our workload volume, the need to do interviews, which is going to increase time. That is not, we don't see that going away. It is expensive, but again, we also are living within the budget that we live in for personnel. And I don't think you can ding me for overtime, but then don't cut my staff.
I hear you on that. I wish we were a bit more realistic in terms of our overtime pieces, because I think that the proposed budget had, what, 25 grand in overtime that you all sent over, which I think you far exceeded that
Yeah,
already.
we always do. But anytime we put money in for overtime, it tends to get swept for something else. So we know that we're going to need to take it out of our personnel line item.
Okay. Just a last question on this. Director Turnage, there were 22 FTEs that you all, healthcare finance,
Commandeered.
detailed, I don't know, commandeered seems a little aggressive. You indicated that those individuals were going to stay in their current roles. Are they going to stay with healthcare finance? Can you mic further?
Yes, and that's permanent as of October 1st, 2023.
Okay. And just overall, has it return to the office increased, in your opinion, affect processing times? For any of it, because I think in the in between of us having from the December hearing to now, the whole EOM went from, I'm not entirely sure, but to 4 days a week in the office. So I'm curious, have you all looked to see whether or not from the processing, whether it be the 22, because I think healthcare finance was in the office before the folks at DHS, to see whether or not this is an interesting sort of study on this, in my opinion. You can turn your mic.
We've not done a pre and post telework change to determine if there's been an uptick. We do look at the overall performance. There are a lot of variables that could, impinge on that analysis that would make your conclusion spurious if you don't really be attentive to the other things that are going on. But it's a good question, and we will take a look at it. But in general, we do look at general productivity of that operation. Eugene runs it well, and he can speak to it. Eugene, if you want to come up and add.
No,
anything.
no. I'm over my time,
Okay.
and I know that the director has to go. What I will ask is that for the Medicaid applications that are currently pending, particularly the ones that have been pending for over 60 days, et cetera, if you could share with the committee, how many of those applications have not even been opened yet? Like, you haven't even gotten to them yet.
Yeah, we can.
Because I feel like that can tell a story. If it is, in fact, the complexity that you've said, then that means that somebody has taken a look.
That's
if
a very
it's-
good point.
If it's not complex and nobody has looked at it, that's something completely different.
Yeah.
And then we could address that in that way.
No, we'll take a look at that. That's a good point.
Councilmember White?
Thank you, Chairperson Henderson. So as I wrapped up my last round, the question I was asking was, what are the specific reasons our error rate was so high? Deputy Mayor, you shared system timeouts and lateness, notice problems, usability, training, payment error rate. What I'm trying to get at is, why are these things happening?
So there are three issues that drive our error rate. They're the way that household composition, earnings, and shelter deduction. So how much someone pays for their rent or housing and the ratio of that to their earnings. So any mismatch between what is reported and what is in the application and then what happens in a case review between those things are the three issues that are most prevalent and the three things that we're focused on in order to bring our payment error rate down. There are two other, we know all of the issues, but those are the top three
Okay. That's,
for SNAP, which is, I think, what you were asking about.
how do those line up with, let's say, system timeouts and lateness?
They don't. That's timeliness.
Okay. So look, I feel, have you all dissected the issue to sort of understand, like, what are the key performance issues that must change in order to drop the
Yes,
the
we
error rates?
have. That's
Okay,
why I can tell you those are our top three. I could tell you what our top 7 are.
Can
And
you go back to those top
all of
three
the
of-
things we're doing for each one of them. So there's the household composition, who eats together
Mhm.
in the family household. And one thing being, and how that's captured in the application versus how that is seen when someone doing QC reviews that person's application. The next is earnings, what they've reported in their earnings and what might show up in a QC review of what the earnings are. And the third is shelter deductions, which is how much they pay for their housing.
Okay, so on household composition, let's just use that one as an example. What's happening there that's causing our error rate?
Um,
I think on that one, we'll have, in some cases, it's a matter of, do we have something in the narrative? In many cases, we're rushing. In some cases, the system's going to have, in one place, it's going to present one sort of household composition, in another part of the system, it's going to show something else, so there's a mismatch. And when the QC comes through there, they see a mismatch and don't know which one it is. And so part of it's, how we train our staff to make sure that we're tying both those things off. Then how the system has flags saying, there is a mismatch here, and go back and do that. And that's what we're working with Tamika on her team on that side. And our side, that's what we're working on our training and how we're making sure that, as we push and rush through and try to get everybody processed, we're also essentially doing the steps we need to do. And that's indicative of not just household composition, but, earnings. And
What's happening in the system that's causing this mismatch? I mean, if you have 4 people in a household, you have 4 people in the household, but you're saying different parts of the system will give different indications. Say more about that.
So families aren't static. And so sometimes there's somebody present, sometimes they're not present. You might have 2 areas of the system that have different information around that. And it needs to be current, it needs to be accurate. I'm going to say one more thing that I will leave you in the good hands of my colleagues, which is that one of the things that we know it will be important for us as we move forward is, as we have to do interviews again, it gives much more opportunity for a worker to go in and ask questions that resolve some of those discrepancies that exist in order to ensure more accuracy. So when we met with FNS on a recent technical assistance visit and went through our entire work plan and all of the things that we're doing, one of the things that they advised around returning to interviews is how crucial that is in terms of resolving a lot of these discrepancies and improving error rate. Because of our timeliness issues, we had looked for as many flexibilities as we could possibly gain so that we could keep up with case processing. So that is not the only thing that we're doing to resolve, but a lot of the issues that we're seeing here where there are discrepancies, because when the QC team gets a case, they spend an entire day or more going through every single detail and sometimes go out and visit that household to get the full picture of what is happening. That is not the kind of time that a worker has to spend on a single case. And so that there is frequently a difference between how they will, with information they will have about a case and what a worker has reviewing a file.
Thank you, Director. I know you have
Thank
to go. I'll continue with questions. So it sounds like, just using household composition as the example, it sounds like there's both a systems issue and a training issue. Is that accurate?
Yeah, I can speak to the kind of training issue and our people.
But
And
but I'm sorry, the narrative, I get lost in narrative answers. It also, to me, is an indication that we don't have a very clear idea of what's going on. So I'm going to try to not do narrative answers. Is the household composition, is that a systems issue, a training issue, or both?
I'd say both.
Okay. What specifically are we doing to address the system issue?
I'd like to have my colleagues at Tamika help me on that.
I would say that it's both.
Okay, so on the system issue, what specifically are we doing to fix the system issue?
We are looking at our business rules, because when we say what's both, we have to make sure that what our requirements are that's in the system aligns with the policy. And so between.
How are you
both,
doing that?
We are meeting, we are looking at the tickets that are coming in when we have those specific issues. We are creating tickets for them. We are meeting with business. We have to prioritize them, based on what's most frequent.
Who's looking
And-
at the tickets?
I'm sorry,
Who's looking at the tickets?
DCASs. So we have a triage team that.
Okay, so
reviews-
there's a specific team
Yes, sir.
that's looking at it. How frequently do they look at the tickets?
Daily,
Okay,
hourly.
hourly? So is
Yeah,
that,
we have a full-time staff of triage. We have about 22 resources that are in there that reviews all issues, all tickets that come in.
what does their review entail?
It reviews them reviewing the problem, looking into the case, determining if it's a system issue, determining if it's a caseworker issue. If it's a system issue, when we could fix it immediately, we will do so. If it's a caseworker issue, we will then review it, tell the caseworkers what steps that they need to take in order to.
It sounds like a
to
triage.
solution. That's what, yes, that's what I said, yes.
Okay, how are we studying all these issues to understand the commonalities? Because what I'm trying to
So
get to is the commonalities tell us what we need to fix.
So then what we do is, when it's an issue that cannot be fixed immediately, we we look at this and put it on our roadmap, where we have then work with business to determine, look at it. We do an assessment, impact assessment, of course, to determine how many people are impacted, if it's prevalent, if it's something that impacts a few people, if it's widespread. We then will review it and put it inside of our release roadmap to
Okay.
address it.
And where does this action plan that you're describing, where does this live in writing?
Inside of our operations, DCAS operations.
Okay, so inside the DCAS operations, there's
Mhm.
specific language about this team, how they triage, how they determine common causes, what they do with those common causes to fix them.
Yes, sir.
Can you, how long would it take you to send me that specific portion?
I will review, and so will probably take a week.
A week? If it exists now, it can't take a week.
It could probably take a week for me to review it, make sure that all the processes are there, ensure that it's up to date and alignment, and I can send it within a week.
All right, if it takes a week, then it doesn't exist.
well-
How would it take a week if it exists?
Okay.
I mean, this should take minutes, right?
I'm telling you that it does exist, and I can get it to you within a week.
Okay, so the difficulty I'm having getting really clear, concise answers as to how you are diagnosing these issues and a specific action plan to fix them, in the long narrative answers are an indication to me that we don't have a clear plan. And so folks are saying we do get you even just a small portion of the plan. How do I resolve this?
Well, let me say, I think we do have a plan, but you got to understand how work flows. When you establish a process and you put a team on it, you don't go back. If there's a modification to the process, you do it in real time. You don't necessarily go back and clean up the documentation that put the process in place in general. You keep working. And everybody understands through meetings, through regular communication, we've made a modification. This is what we're doing now versus what we were doing last week. What Tamika is saying is before she just picks out a document and sends it to you, she want to make sure it reflects all the changes they are making and they are executed at this time. I mean, there's no different than what we might do at DHCF. If we have policies in place and those policies change, if you ask for that policy on day one, we have to check to make sure, does this reflect what we're doing now? We don't sit down, I mean, time is important. So we don't automatically go back to a source document and change it every time we change an operation. But we understand that operation has changed and through communication with staff and with their managers. And when it's necessary, we'll go back and we'll refresh the document. I mean, a week is not a big deal, but the work continues. And the work reflects the adjustments they've made to address whatever problem they're faced with.
If we were only talking about a week, then maybe it wouldn't be a big deal, but we're now talking about months or years.
No, I'm talking about the time she said she would send you the document.
Okay, but this system isn't going to be fixed in a week, and it absolutely won't be fixed in a week, a month, or a year if there's not a really clear, concise plan that is implemented within the agency. And we're talking about here a system that costs taxpayers $600 million.
I think if the desire is to see on day X that the system runs perfectly, similar to what the deputy mayor said earlier, that's not going to happen. Because it's not that we have a set of rules and requirements from 2 years ago that remain static forever. We have new rules, new requirements, new changes, new issues that pop up constantly that then to the point of the roadmap, for example, last year, we learned that CMS changed their interpretation or updated their interpretation of what they expected for passive renewal from children on Medicaid. That wasn't, and we were not compliant with that, and we had to fix it immediately. We weren't expecting that. It was not on our roadmap, but that happened last August. We made that change. That changed all the priorities, changes the roadmap. We have new federal rulemaking that will continue, we'll have changes over the next 2 to 4 years to become compliant with that. So we're not going to have the luxury of day X of saying it is perfect and everything is done. It's forever changing. And then when you have an integrated system that's bringing in not just one federal program, but several federal programs, it's the constant ebb and flow and trying to make sure that we're supporting and working as best we can and having it as smooth as possible. And then when we have issues, when folks have a coverage disruption or it's taking too much time, we try to resolve them as fast as possible.
I appreciate that. And I will wrap up here. What I'm suggesting is you are right. It won't be perfect in a week. It may never be perfect. But if we are not distinguishing between one-off issues and broad system issues, then we're never going to reduce that time frame, and we can't react the same. So we have to have a strategy. The strategy has to have already diagnosed and dissected what are the key drivers of this performance rate that is unacceptable, and for those key drivers, what is the strategy and action plan to address them? All the other things that move, throughout the day, a new problem tomorrow, those aren't the key drivers. And we have to be able to distinguish, and we will not fix if we don't have a strategy to understand the key drivers and to fix the key drivers. And I still don't understand what that is.
We definitely look at one-off issues versus systemic, and that's part of the triage group. When we get something in, it is that immediate, let's fix it right now. Is it something that is a one-off? And my general rule in my 20 years now I'm doing this, by the time you hear it about 3 times, it's probably systemic, right? If you hear about 3 different constituents and then we move it into the stepping back, bringing in when Ms. DeWitt says, business, that's bringing in DHCF, that's bringing DHS, and figuring out if there is a bigger systemic issue and then how we resolve it. So we're doing both all the time.
Thank you. I apologize for going so long over.
Okay. I think I asked this question before, but was there a time where in our health and human services systems in the district that we had one team work on Medicaid, one team work on TANF, one team work on SNAP, et cetera?
No, not as I recall.
So we've always had where there's one team that processes all of the applications?
Since I've been in DC, DHS has always been the agency that handles eligibility for TANF, SNAP, and Medicaid.
I understand that part.
Right.
What I'm suggesting is.
Oh, you mean, have we segregated workers?
You have 288 people who are processing applications and we say,
Yeah, I think,
this third is going to do Medicaid, this third is going to do SNAP.
I think everybody's cross-trained.
Wait. I can clarify.
Yeah.
We do have some segmentation.
Oh, you do?
So yeah, part of our training, we don't train everybody all at the same time on every single program. We sequence it. So for instance, we've had pressures right now on SNAP. So we're front loading the SNAP training. And so we have more folks trained on SNAP and now we'll roll folks into training on Medicaid. We have a smaller TANF caseload. So by definition, we trained a fewer number of our folks on TANF. And then how we have things set up, we have a queuing system, which is not done through DCAS, but it's a separate system. And so we have a dozen different workflow queues, and we have people assigned to the workflow queues based upon the training they have, as well as kind of aptitude they have.
Okay.
And so we do segment it that way, and that's part of our strategy in terms of how we try and be efficient about what we do.
Okay, so one of the things that kind of stood out for me from the pre-hearing responses, where you all, DHS provided recommendations in terms of how to improve SNAP processing. One of them was, quote, request for DCAS to put a trigger in the system that only allows for one person to work on a case at a time, end quote. Can you explain this more? Are there errors occurring because more than one person is in an application at any given time? Either Ms. DeWitt or Mr. Campbell.
Yeah, I think what this might be referring to are duplicate cases. So we have a case coming in, and so for instance, Ms. Henderson, you might have applied once and you applied again, but you apply and the second time you apply, there's two ends on Henderson. And so we don't know that's the same person. And so I might be picking up and Tamika may be picking up and both working it. That's one of the things that we're working on in terms of the kind of the case
Okay.
reconciliation.
Wait, are we linking by name and not birthday?
No, so there's multiple, that's.
Oh, okay, because I was,
There's
you know,
multiple, that's just a.
common names exist.
Common
so-
exists. So we have multiple linkages, but we do have multiple kind of duplicates in there. And so how we make sure that we merge the duplicates and bundle the duplicates and functionally bundle the duplicate tasks. Because I might have submitted one thing on one case for SNAP and another thing on Medicaid. So they're all bundled together and then escalated to the highest level of
Okay.
worker need on that.
So is there some particular reason then the DCAS system doesn't spit somebody back out when they are already in the system? So like, for instance, like I haven't signed into a website for a while and I go to like, oh, I need to create a password or a login. And then they say, nope, you're already in our system. Why doesn't that happen? And it allows for people to submit multiple applications, even though they've already have one.
Regulations.
Right.
Regulations. We are not allowed to deny someone or to tell them that you already have an active app. We have to take in all applications that come in, disposition them.
Well, federal regulations, I don't know, after this week, do they exist? We'll see. On that front, we talked about in December, this whole notion of us continuing to send mail, even though we know the address is wrong. And I think it was Eugene who talked about how much mail back that you all get. You all testified in December that DHS had received a $1 million 3-year grant for digital mail room to address challenges related to return mail. What's the status of this grant and what exactly will you all be doing with that funding?
I don't have enough confidence to answer that before you right now, just based on what I have. We'll get back to an answer on that, but it's in process right now. And we also at the same time are doing things in terms of data reconciliation on our address front to do cleanups both on our side.
Okay, just for context, how much mail have you all gotten back so far this year?
I don't have that.
Eugene?
I don't have the exact updated number, but I think when we last testified, it was something like 1,000 pieces a week is
Yep.
what the vendor who we have working with DHS is sorting through.
Okay. And so what happens in those cases when we get the return mail?
So a few things. If it's a Medicaid renewal, the unwinding, Eugene Sims, Policy Director, DHCF.
Oh.
The Deputy Mayor doesn't like me to get up here and just start spewing. So if it's a Medicaid renewal, we have to go through a few steps. It's at a high level, it's 2 contacts before we're able to, say, hey, we can't take any further action with this. We're required to reach out to them via alternative modalities.
Okay, so
like-
after 2, you can put them in a different, or do you have to keep that address because of regulations in the same way that we can't tell somebody you've already submitted 4 applications,
So
go away?
if we don't have another data source, we can't update the address. So we are working with our MCOs to try to update addresses. I'm sure DHS is taking some other steps. I think one of the unwinding flexibilities called E14 waiver flexibilities we had was to allow us to, if we had a NCU, I think it's the NCOA address, which is the federal mailing date. Yeah, National Change of Address Data Hub. We could use that information. We can use MCO information. And I think we were also working on trying to get CMS approval of allowing us to use health home provider information to update those addresses. So we were taking those steps. And also if that wasn't successful, we required to try to reach out to the individual via these at least two modalities before we can say, okay, we can, we can't update the address. We can't reach this person. Let's move on to the next piece of return mail.
Okay. I wish that the federal government had like a comment box where we could say, hey, this regulation, while good natured, is actually causing more troubles for a variety of reasons, whether it be the return mail, that we continue to send information to the wrong address. Postage isn't free. Like, right? You can't say we are being charged postage every time we send, even though we know we're going to get it right.
And I think one of the requirements of the new regulations is that the paperless option is something that individuals will be able to select in the future. I know that's something we're working toward in DCAS. So for the folks who are connected, who are willing to select that paperless option.
But it's opt-in, not opt-out.
Correct. It will be an opt-in process.
Interesting. Okay. Mr. Campbell, one of the things that we realized from, so different than the payment error rate, there is the district's case and procedure error rate, CAPER. And for the public, the CAPER is another important metric for the district SNAP program, measuring how often a state takes one or more inaccurate or procedurally incorrect actions when denying, terminating, or suspending a household's particular SNAP benefits. So our CAPER rate in 2023 was significantly higher than the national average. We're at 53.7%. What my question was going to be in the pre-hearing responses that you all provided to the committee, it appears that these error rates vary significantly based on service centers. So for instance, the error rate at your Congress Heights location was higher than the Anacostia service location in the second half of 2023. What do we attribute these differences to? Is it a volume difference that's going on? And how are you all using the knowledge that specific service centers might have some different challenges than others to do retraining or retooling?
Yeah, it's probably like a combination between volume and also candidly management, making sure we have consistent management across our service centers. And so, as you know, we have 5 different service centers, and with the management team, there's best practices sharing and looking at data across the centers. I will say that our CAPER rate, while it was high, we in fact in December, so in FY24, have dipped below the national average on that. So we've had tremendous improvement in terms of working with Tamika and her team on those notices. And so that's a product, frankly, of working collaboratively and also seeing what's going well at Congress Heights and where we're struggling at Taylor Street. I don't remember candidly if it's Taylor Street, but just to your point, identifying what's working well and maximizing that.
Okay. I want to ask a quick question about the Sunbucks program.
Sure.
So as part of the funding that DHS required for implementing Sunbucks, DHS stated that they needed funding for 16 FTEs for a call center. Did you get those people?
We have the call center up and running right now.
Are these new FTEs or did you?
These are contract folks.
Contractors. Okay. All right. And the first $40,000 5,000 benefit cards already were mailed out in mid-June, which is great. How many left do we have to go?
So those, to clarify, those were, we could identify some which were categorically eligible. And so we pushed all of those out, and those are all out. They should be in people's hands right now. We are issuing additional we're issuing an additional 5,000 folks who applied through the portal. So folks who are not categorically eligible, the first 5,000 are going out, if not this week, the first part of next week.
Okay,
And we'll do accompanying notices, frankly, we worked with DCAS to help us get those approval notices out too. And then we'll do it on a rolling basis. I mean, it's OSSI developed the system, the application system.
Yep.
They do a recommendation, we approve it, and then push the benefit through our FIS or EBT vendor, our card vendor.
okay. So for the 5,000 folks who applied, some percentage of them are probably ineligible.
Like,
Some,
clarify,
oh, yep.
5,000 approved.
Oh, okay. Do you know how many applied? Just curious.
Over 10,000. Some of those
Okay.
applied were already categorically eligible.
I
And
see.
so by definition, and some of them were multiple applications. And so the number of, I don't have the data, but the number of kind of straight up folks who applied but are not receiving a benefit at all is far smaller
Okay,
than that.
thank you. Councilmember White.
Thank you. So we were talking my last round about the specific reasons for our error rates. What I want to understand in this round is what specifically are we doing to fix it, which we started touching on, but also specifically, what are we doing now that is different from, let's say, December when we had the last hearing?
Well, I can certainly speak on the process side. And just maybe I'll speak some things on the system side because it's a complement of both respective things. So one thing that the director spoke to before she left is the errors are identified by our QC. And then she says that's separate from the ESA part of it. But the QC identifies the errors, and then what they're doing is going and having essentially a joint conference. There was one just yesterday, which I participated in. It was 2 hours, and thankfully Tamika was there as well. Going through case by case, what the error was, how it was found, where it presented, and then working backwards. So identifying the root cause that, thereof. So we could see, okay, is this isolated or does it reflect, and frankly, most of them are going to roll up into one of the three things that the director identified. The earnings, the household composition and shelter deduction. So it rolls up there. And then, breaking down from that. So that's a very, very concrete thing we've done there. Another concrete thing that we'll be doing in the future is restarting the interview process. Now that was, on one hand, it relaxing, it allowed us to get everybody processed during COVID. And when we always say we've had an increase in 40% of our SNAP caseload. We could get those through. But when we're interviewing folks, we're going to be able to go back and identify, say, okay, you've suggested this and this and this, but we're seeing a mismatch here. And so by having a conversation, be able to, our supposition is identify and solve a lot of those things right there. The
Interviewing,
accuracy, excuse me.
applicants,
We'll be interviewing applicants, and
all of them?
all SNAP applicants and all SNAP renewals. For folks, we have about 30% who are an elderly simplified, which means that they have a 36-month cert period. They will not need an interview at recertification, but will need one at initial.
Okay.
And we'll also do it at expedite.
What percentage roughly of people of applicants are interviewed now?
Excuse me?
What percentage of applicants are interviewed now?
Well, there's no interview required now.
Okay.
What we've done there's another thing that we've done since last hearing. Each of
So
us,
how will the interviews be in person?
in person or over the phone.
Or on the phone? Okay.
Can I add one thing that you asked? In fact, you came and observed us at Taylor Street.
Mhm.
And since Taylor Street, we've essentially done expanded services at each of our respective centers where we're doing essentially sitting down with folks and doing kind of a one and done, one-stop resolution where there's effectively an interview taking place there right now. And
Okay,
so
I'm going to trust that the interview process is necessary. How does that not expand the timeline?
well, it does.
Okay, so
mean, it
will
will-
SNAP applications take longer going forward?
It will probably take a little more time going forward by nature of the fact that we're having a conversation. And it's required by FNS, first of all. So it's not something that we can't, we haven't done it and we're going to be required to do it. But part of it is our strategy, and what we've applied for is what's called an on-demand interview waiver.
I don't want to go too deep into what's
Fine.
on the interview.
Sorry.
Let's go back one step to the meetings you mentioned on the QC. What's a QC?
Quality control.
Okay, quality control. When did those meetings start?
We've stepped it up this calendar year. When we actually started, I don't recall. Do you recall, Tamika?
No, they've been in place.
Can you turn your
but
microphone on, please?
As Brian is saying, they've been in place, but collaboratively, we just started, DCAS started joining and we've expanded, DHS has expanded the audience there so that we can look at the issues and, as you're suggesting, determine what the root causes of them are. And then we can assess that and determine if it's a, fix that needs to happen from a caseworker side or the system.
And when did that change take place?
We've had, I would say in the last 3 months, I could speak to when I came back, within the last 3 months, because I know I've been to 2 meetings so far.
What data do you track to determine whether or not that specific strategy is working?
We use the findings that we get from QC. We then
What
also,
findings?
so what QC comes back is they do their review, they review all the cases. They, with their sample, they come and let us know what the issue was. Correct me if I say any of this wrong. They come back and they tell the agencies what they observed that is not correct. And then based on those findings, we will review them internally again, and look at any of them that have the system impact. Those are logged in our system that I referenced earlier. And then we will review that to determine if there's other tickets in our system that already, that has already been identified. And we will add that to, again, do an impact assessment to determine how many folks this is impacting, and then determine if it needs to work with business to put it on our release roadmap.
And this is an effort to reduce error rates.
Correct.
Right, okay.
And
What is the data saying about this specific effort to reduce error rates? Is it helping or not?
so the one challenge with error rates, with timeliness, we know right away what's going on because we report that at the end of every month. I mean, I can tell you what last month was at the last day of the month. Whereas the error rate, because it's a QC review sample size, there's about a 6 or 9 month lag on that. And so we are lagging in terms of when we see that data. So that's one of the challenges we have. So while we're not going to have the official data, what we're trying to do is go back and be very, very detailed in terms of having these reviews, as Tamika and I shared, with QC and QA, and then going back and identifying and working it backwards. And so theoretically, we're
There are
addressing
no
it.
metrics that you could utilize that would give you an indication in less than 6 to 9 months as to whether the effort is working?
Yeah, so a QC is, I mean, timeless is looking at the entire caseload. QC is looking at a sample size. When we're not doing sample cases more proximate to the actual time that we're doing the intervention, there's a lag. Like I said, we can go back and take a peek. I haven't thought critically about that, whether there's a way to do it in more real time.
All right, I have a lot more questions, but I think the result of all these questions is going to be a lack of clarity around the diagnosis, a lack of clarity around the plan, and a lack of clarity around what metrics you're using. Here's what I would ask. Could you send to the committees a document in plain language, something that the average person can understand, to help us understand using data and metrics, what are the key issues causing the error rates? And the second question is, what are the specific strategies for fixing each of those key issues? Again, my request is in plain language and using whatever data and metrics you use. What I hear from the questions is you already have that. If it takes you a week, 2 weeks to clarify it, polish it up, that's fine. But is that a fair request?
I mean, it sounds like we'll work together on that.
Approximately how long would that take to get to the committees?
We're looking at QC, the payment error. I would say that I would respectfully request at least 3 weeks.
Okay.
3 to 4 weeks to review that.
Let's, let's, let's make it 4 weeks, and that way, hopefully we can avoid an extension. So July 30th?
Yes, and I just want to clarify, it is what metrics we use in order to look, to review any of the payment error.
A document in
Mhm.
plain language using data and metrics. And the two things that I want to understand in this document are, with respect to reducing error rates, what are the key issues causing the error rates? And what specific strategies are you using to fix each of those key issues?
That's clear.
Thank you very much. I'm not going to keep asking a lot more questions, but I may jump in for rounds like here and there, but I don't want to waste anybody's time.
Okay. All right, I have a few more questions on the Medicaid side of things, and then also OAH review, which I feel like is a component of some of the applications that are currently pending. Um, Director, one of the, well, I'll ask it from your deputy mayor hat. One of the things that you all have said that has led to some of the processing challenges have been in terms of seeing record number of applicants. And I'm curious, you know, so far this year, how many new applicants are we seeing a month in terms of, say, Medicaid, for instance? I'm sorry?
I don't have the number with me, but I can get it before the end of the day.
Okay. The Medicaid director,
It may even get it while we're in this meeting. We're pretty efficient over with our Medicaid.
new applicants. Never had Medicaid before. Like, how many people are we seeing? Is it like some tsunami influx of individuals or otherwise?
No,
I don't know. Mr. Campbell, if you know that info for SNAP or TANF?
Medicaid applications, new applications before the pandemic, you didn't see there wasn't a massive number of new applicants. I think the growth rates used to be around 2 or 3%. I don't know what they are now. Pandemic sort of
Okay.
came in and it changed everything. But we can get we can calculate the.
So I would be interested to know in terms of how much time are we dedicating to brand new folks versus how much time we're dedicated to the folks that are already identified in the system, and yet we haven't just processed their information. Does that make sense?
That's a different point. So you want to know the number of new applications per month?
Yeah.
Over what time period do you want to see it?
I mean, if we could just say for this fiscal year,
Okay.
how many new folks are we seeing, just as to get a trend? And one of the reasons I'm asking that is that the percent of new Magi applicants that took over 45 days to process has fluctuated between 23% and 47%. And so I'm just trying to get a better picture here, how many people we're
So
talking
we get
about
about 1,000 to 2,000 new applications a month
for Medicaid.
for Medicaid.
Okay. And we don't have the numbers for SNAP or TANF?
I think my team, it's lower than that.
Okay. Okay. On the Medicaid front, one of the concerns we've heard from some newly returning citizens who have been having trouble accessing their Medicaid benefits once they've been released from jail because the I code had not been turned off, indicating that the individual is no longer incarcerated. Is this a DCAS system issue or is this a information sharing issue?
It usually, well, I know a couple different things. It's usually a little bit different response depending if someone's coming from Department of Corrections or someone's coming from Bureau of Prisons. And most of our folks are going to return from BOP, Bureau of Prisons. We now have an overnight or daily fee between us and the Department of Corrections, so we can, update that. And we've eliminated a lot of the issues with the I-code transition. It used to be an Excel spreadsheet shared between agencies. And then Tamika can add anything to that. And typically, unless she'll correct me if I'm wrong in here, BOP is just more challenging to know when someone is actually returning home. And so that's a larger issue to resolve because it requires coordination on the federal level. It's just not as easy as working with Department of Corrections.
Okay.
I will say, you know, through our 1115 renewal request, we did ask for the authority to do, you know, certain services for folks who are returning to the district.
Mhm.
BOP is specifically excluded from federal guidance, but we have asked them, because there's federal responsibility and whatnot. And in most states, folks are going to go to a state prison and less likely to go to BOP. We are an anomaly where like 70% of our folks will go to BOP, where the national average is 11%. So we've asked for some flexibility to demonstrate that that would be something that would be beneficial to our residents. And so I think if we have that opportunity, we'll have a better chance to connect with folks before they leave BOP and get them. The whole point of that is have some kind of case management locally to have a more seamless return or coverage when they come back. That would be some time off. I don't know if it'll happen, but we see that as an issue as well.
I was just curious in general, how often do you all have to remind our federal partners that the district is unique? Like, whether it be on this, whether
Territories
it be
would
on
say the
prescription
same thing.
drugs, like on any number of things. One day you want to treat us like a city, and the next day you want to treat us like a state. And then the next day you want to say we're not eligible because we're not a state. What? Like, pick one. Okay, I want to ask some questions about Office of Administrative Hearings. Director Turnage, at the December hearing, you testified that the appeals process within the Office of Administrative Hearings is a safeguard for challenges with DCAS enrollment. However, at OAH's FY23 performance oversight hearing, they indicated that they've been struggling to keep up with Medicaid appeals. In Q1 of FY 2024, OAH said they received about 370 Medicaid appeals, more than half of the total amount from FY 23. So in Q1, they're already exceeding what they saw last fiscal year. As a result, the average time from the filing to the initial event has increased from 49 days to 63 days. What communication have you had with OAH leadership about the increasing caseload and their capacity to process it?
Yeah, when Eugene can handle, we talk to them a lot, but you know, the caseload issue is their caseload issue is a difficult one for us to contend with. But Melissa, you can.
And the numbers, do they specify, excuse me, in those numbers, if they're related to applications or to services? Because what we see typically through the appeals process is individuals appealing their long-term care assessment for level of care and number of personal care aid hours. So oftentimes someone has been getting 14 hours, they feel like they need 16 hours and they appeal that. And we stayed on any reductions until the end of the PHE. And so now we're enforcing when we see a reduction in numbers, or if there's an increase, obviously we'll increase. And so you've seen an uptick in appeals on that front.
Okay. I don't think OAH disaggregated it based on, I think they just did by type. These are the number of Medicaid applications that we have versus service versus
Because
application.
remember, there are very few. We terminate 6 to 7% of the applications in a given month for recertification, and most of the reasons that we terminate are pretty clear and irrefutable. It's generally over income, which is one thing that kicks people out. Now, if there's a non-response and we give the notice and then we terminate, and they want to challenge that, they can. But I would be surprised.
Okay.
I would be surprised if there were a lot of appeals about whether or not they were denied access to Medicaid
Okay.
Unjustly.
But even on the long-term care determination piece, did we give OAH a heads up that, hey, this change is
Our long-term
coming?
care administration, along with our Office of General Counsel, and I believe, well, they meet quarterly, I believe, just to touch base on these things. And then we do, if not, I can't remember the cadence, is at least once a year, if not more frequently, we meet with the OAH as well when we've had significant changes in policy or, you know, changes to our rules, if you will. We have briefed them so that they have an understanding of what might be coming before them.
Okay.
Like we met with them before renewal started.
Okay. Mr. Campbell, similarly, OAH reported that the average time from filing to initial event for SNAP applications has increased from 36 days to 61 days for regular appeals and 24 days to 58 days for an expedited appeal in Q1 of FY24. 58 days for an expedited appeal, that's not fast. That's
It's not fast.
That's slow. So what conversations are you guys having with OAH leadership about capacity?
We have quarterly meetings with OAH on specifically on kind of what's going on, similar to what was shared.
Okay,
At the same,
is quarterly enough?
it's a good point. I'll take that. May need to ramp it up. At the same time, what we're doing on our side is when things come in, having our DPO take a look at it and say, is this something we can resolve before it gets to, I mean, clearly we need to do an admin review, but we're doing a step before an admin review saying, can we take care of the issue right now so it doesn't get there? And so then it's withdrawn. I think we're seeing more withdrawals now. than we
Okay.
have, because we've been able to go and do either an administrative review or even before an administrative review and our escalations team taking a look and saying, this is something we can fix.
Okay, so the difference, I think, in terms of like a Medicaid redetermination versus like a SNAP application is that while the Medicaid, well, technically how the system is supposed to work, while a Medicaid application is pending for review, if a redetermination, that person still has access to their insurance. On SNAP, as you guys are reviewing, that person doesn't have access to their benefits, correct?
They can be reinstated pending, but not for all cases. I think that the request needs to be made to continue it,
Okay,
but I will follow up to make sure that I'm not misrepresenting.
okay. Director Turnage, from your deputy mayor hat, like, are we having a larger conversation in EOM and the cabinet about whether or not OAH is in need of more ALJs to handle the caseload here? Because
I've not been a part of that conversation, but my on the ground assessment is if the only thing we can do for them on the Medicaid side is if they need more, we pay for a portion of their costs through claiming on the Medicaid side, but we have no capacity to increase their capacity. So I've not been involved in those kind of discussions.
okay, Medicaid doesn't have
Right.
the ability to increase their capacity, but
Yeah,
deputy mayor.
because they deal with a lot of issues. That those discussions may be taking place, and I'm just not a part of it. I have not focused on that.
Okay. Can we put some
can-
attention on this
Sure.
summer?
Absolutely, I can talk to the Mayor's Office of Legal Counsel to see what their views are on this and whether or not they
Okay.
have some idea.
If this is how they are, I'm gonna guess. If this is how they're doing on Medicaid and on SNAP, I can only imagine what's going on with unemployment and the other cases that they are seeing as well.
Yeah,
And so I don't know what the strategy is. I don't know, people think of OAH as a small little agency or small little office, et cetera. But like, if they need more support, then they need more support. We gotta figure that out. You all might be gone before this, before they testify, but in legal aid's written testimony, they say DHS continues to withhold benefits based on a DCAS error, even when the agency has been ordered by OAH administrative law judges to release those benefits in the course of a fair hearing. The testimony asserts that DHS insists that the benefits cannot be issued until the underlying DCAS error is addressed, even after acknowledging that the benefits are owed. What's the response here?
are we talking, what, are you talking about Medicaid? What are
No,
you talking about?
I'm assuming that this is in reference to SNAP.
I'm not familiar.
Yeah,
with that.
I can, this is probably reference to SNAP, and there certainly have been some cases which we've struggled to get through with a number of different things. We've got exception reports to work those, so we don't have those go, but there have been a couple which have lingered on, and they're not acceptable. I'm not gonna sit here and say they are. We know that. And so we've built a series of exception reports so we can, avoid the situation. We also have monthly conversations. I think it's enough at this point with some of the bit larger, with Bread for the City, Legal Aid, and others who do more fair hearings to make sure that we are aligned with them as they do escalations, and we're being responsive to escalations as well as being responsive across the fair hearings. So it's
Okay.
been a far from perfect process, to be sure, but I think we are having conversations, and I feel like we're improving.
When there is a order by the judge to say like, no, the agency or the system screwed up here, is that not expedite it for resolution?
Yeah, we do. We certainly do. We have a specific unit
Okay.
that we will send it to. In fact,
But then when they say though that DHS insists that the benefit cannot be issued until the underlying DCAS error is addressed, is that your team, Ms. DeWitt, that has to then fix it?
So what I would say is that for issue tickets that coming through DHS, that we resolve tickets within 72 hours for 96% of tickets that come in. So for any lingering tickets, I would need to know exactly what those are and be involved in that to speak to that.
Okay. Is it possible, I don't know specifically in terms of the clients that legal aid is referring to here, but is there a person that they can reach out to say like, here's the case, here's the order, and then they're telling us that this is the issue?
yeah, in fact, and legal aid has direct contact to both me as well as folks on our DICM team, which interfaces with Tamika and her team on specific ticket issues. So they can certainly reach out to me personally.
Okay. Hang on one second. I don't think I have any more questions at this point. I would say this. I know that this doesn't seem like, oh, it's not that many people percentage wise in comparison to other jurisdictions, et cetera. But I don't like to give anyone on the other side of Pennsylvania Avenue any additional ammo to come after the district to say that either we're not doing something properly, we're doing something wrong, et cetera. And so when we get penalized for overpayments, or we have these number of cases that are pending, it's particularly for DC, it's like we're putting a target on our back. And so we got to figure something out here, because even, Ms. Bird, after you talk about like the 1115 waiver, which I'm super excited about our application, but then I read that, oh, so many states are submitting 1115 waiver applications now that the time is being delayed. Like, I don't know if it's uncertainty is in the air. And so however we need to hunker down to kind of fix some of these issues so that we're not a target on just basic, our ability to process public benefits, I think is super important. I want to, yep. I just want to go over the follow-ups really quickly, and then we could be done. In terms of this particular portion of the hearing, Ms. Bird, I would love to set up a separate meeting with you to discuss some specific issues as it pertains to the Alliance program, if possible. Okay, so first, a follow-up for Mr. Barnell, who testified in terms of his Alliance benefits.
That's been done.
Second, the number of Medicaid pending applications that are unopened versus complex cases would be helpful. Third, an update on the digital mailroom grant that DHS has. Fourth, Councilmember White's requests for the plain language document using data and metrics on key issues causing error rates and specific strategies to fix these issues. Is that the accurate description? Okay. And then fifth, a follow-up on if residents have access to SNAP benefits while they're waiting for an appeal to be processed. All right, Councilmember White, if you have any closing for them.
I just want to thank the government witnesses. I think we all recognize the importance of what's happening, the difficulty and the urgency to continue moving forward. So thank you very much. Thank you, Chairperson Henderson.
Thanks. Can I ask one follow-up question that just came about
Sure.
Sunbucks? Sorry. Have you all been hearing any complaints and or issues around people receiving a Sunbucks card for another individual?
No, you mean just went to the wrong address?
Correct.
We'll check it out.
Okay,
I'm not aware of anything that's, but I'm not saying it couldn't have happened.
okay. I'm just wondering in terms of if anybody's calling into the call center, we've just seen it pop up a couple of times.
Gotcha. Thanks for flagging it.
All right. Thank you guys so much. Oh, Mr. Director.
I just want to close by saying DCAS is a very complex system, and it is asked to do much, and not in a static environment. We get major changes. It's like trying to fix an airplane on the fly. It could be it could be sunbugs. It could be the extended SNAP benefits. It could be changes coming down from CMS. Those things have to be hardwired into the system. And oftentimes we have to be cognizant of whether or not a change we are making based on a new directive has some adverse impact on some other part of the system. When you consider all those things, and when you consider that we are serving 300,000 people in Medicaid, don't have the exact numbers in TANF, SNAP and TANF, I think we're doing fairly well. Is there a target on our back for error rates? Yes, and I think we will resolve that. I don't believe there's a target on our back on the Medicaid side. CMS knows that a lot of states have pending cases for a number of reasons, and nobody's losing coverage. So our Medicaid renewal rates are very high. SNAP timeliness and TANF timeliness is increasing significantly, mainly because we prioritized those case processing at the expense of Medicaid. And we recognize that there are problems with trying to address the long periods of time that people stay in pending and the error rate. The challenge we face is trying to decipher what is caseworker driven and what is system driven. And when we do that, we make some significant progress towards fixing it. We have a good system. We're looking forward to bringing on an operation and maintenance team that will certainly improve and make sure that the system is operating on a daily basis as effectively as it can. And as I tell my staff and as I say publicly, if you have a problem with your application, call me. I will make sure. If you call me, if you text me, that's the best way to do it. You send by email. I typically get emails to that, but if you call me or text me, I will make sure that that situation is addressed as soon as I get a text. I'll send texts emails at 1, 2 in the morning. When I get a text, I'll send them any time of the day, and my staff are excellent, and they get right on these issues. Now, I know it is difficult to have a process where your default system is the director or the deputy mayor, but if I am having trouble and I've heard this message, I'm going to call the deputy mayor or the director. That is not the way we build a solution system, but it's the solution I use when people call me and say they're having problems. And when I use it, it's generally addressed within a day. The gentleman that spoke this morning, we have identified what the problem was. It was a system, it was a caseworker error. Now he may not be eligible, but we're going to pay for his benefits all the way up to October 24th, although he may be over income now from the Alliance. We'll do that because we made the error initially. He may have put off some much needed health care. So we're going to tell him today, go get your health care done, send us the bills, and we're going to pay for it. Now, he needs to get it done before October 24th, because then we have to reevaluate whether or not he's eligible. So, I mean, and that's how it's worked. It's not going to be a perfect system, but I think it is a very, very good system that was built by competent vendors at a significant cost, undoubtedly. But, I tease my staff, it costs as much as the baseball stadium, but it is more valuable than the baseball stadium. Yeah, no, not good ones. So thank you. We are certainly willing to respond to any questions and concerns that you all have. We endeavor to get you what you need to evaluate us and conduct a proper oversight, and we will respond expeditiously.
Well, thank you, Deputy Mayor. And again, I do find you to be incredibly responsive in your team when we reach out to you about specific things. I just wish I'd never had to go to the Deputy Mayor to resolve specific casework issues. And as you said, that's not a permanent solution.
Right.
Especially for a program, not just a system, but the program in general that is what, multi-million, probably $1 billion piece of our budget at
Right.
this point. And I also don't think it's any insignificant thing that we get penalized 4.4 million in the middle of what folks say is that's $4 million we could be using for something else. That now has to be, as you said, as Director Zeilinger kind of alluded to, it has to come from someplace else, not within DHS, or $2 million, 2.2 million. So, I guess we'll anticipate to see whatever that particular reprogramming looks like in terms of that being paid. But we'll keep the conversation ongoing, and always appreciate you all being willing partners to have conversations with us about how to improve various things. All right, with that, if we're going to take a 5-minute break and then we'll get to our public witnesses. Thanks so much again for your time. Okay, we are back for our public witnesses. Thank you again for everyone for your patience. So we have 2 in-person public witnesses. If there are more and you didn't let us know, let me know. So I have Nadine Coy from Health Services for Children with Special Needs, and LaMonica Jones from DC Hunger Solutions. Is there someone else on the public witness list who is anticipating testifying in person? No? Okay. All right. So we'll go to our online folks just so we can have a full panel here. So Stephanie McClellan from DC Kin Care Alliance, Eric Romero, and Allison Miles Lee from Bread for the City. And for folks who are testifying virtually, for those of you in the room, they'll appear on the screens. For the virtual folks, you need to affirmatively accept our invitation for you to become a panelist and to join us. All right, Ms. Coy, when you're ready.
Good morning, Chairperson Henderson and members of the Committee on Health and Housing. My name is Nadine Coy, and I am the Chief Operating Officer of Health Services for Children with Special Needs, also known as HSCSN, a Medicaid health plan licensed in DC. We are part of the HSC Health System, a subsidiary of Children's National. Thank you for the opportunity to testify today at the roundtable on the DC Access System and Public Benefits Enrollment. HSCSN partners with the Department of Healthcare Finance in serving over 5,000 special needs children and young adults with disabilities from birth up to age 26 in the district through the Child and Adolescent Supplemental Security Income Program, known as CASIP. We provide specialized benefits and services for some of the district's most vulnerable children. Continuity of services with HSCSN is key in ensuring that our enrollees and families receive the specialized care they need and the supports they deserve. In April, our president, Anna Dunn, shared a brief update with the council on our partnership with DHCF to ensure continued coverage to almost 500 Medicaid beneficiaries at risk for losing their health care coverage, arising from the unwinding of the PHE. I'd like to take a few moments to share with you a bit more detail on the collaborative efforts of HSCSN and DHCF between December of 2023 and May of 2024, and the success we achieved in ensuring access to care for CASIP enrollees. Beginning in December of 2023, DHCF was engaged in identifying potential causes of Medicaid beneficiaries, predominantly those receiving supplemental security income benefits through disability status, losing their health care coverage. Following the institution of a widespread pause on disenrollments of all SSI children up to age 21, HSCSN and DHCF met weekly to continue analyzing and problem solving for long-term solutions. DCAS implemented several systemic and procedural enhancements to mitigate further disruption to enrollee coverage and worked in tandem with HSCSN's team to review the outcomes. The disenrollment pause for SSI children ended on April 30th, 2024, and HSCSN is able to report there are no continued concerns with erroneous loss of coverage. Through these collaborations and the commitment from DHCF to ensure continued access to care, HSCSN is continuing to serve more than 350 beneficiaries who, without their partnership, would have had limited or no access to Medicaid covered benefits. HSCSN is deeply committed to our mission of providing specialized services and supports to children, adolescents, and young adults with special healthcare needs. Our partnership with DHCF is paramount to our mission, and we thank you for the opportunity to share the details of our success in maintaining coverage of CASIP enrollees. Thank you.
Thank you. Ms. Jones?
Good morning, Chairpersons Henderson and White. Thank you for convening the Joint Oversight Roundtable to discuss the performance and operations of DCAS and District Direct. My name is LaMonica Jones, and I have the honor and privilege of serving as the Director of DC Hunger Solutions. DC Hunger Solutions has a long-standing committed relationship with working with district residents, providing SNAP application assistance, outreach, and technical assistance. As an established organization serving the District of Columbia for over 20 years, working to improve the nutrition, health, economic security, and well-being of district residents experiencing low income, while educating the community at large on the state of hunger and poverty in the district, along with its root causes. We strive to ensure the execution of SNAP, our nation's leading first-line defense of hunger, is performing optimally in the district. DC Hunger Solutions works extensively with SNAP-related issues, supporting over 135 clients throughout the district. As the district continues to grapple with the impacts of the pandemic, the loss of pandemic-era funding and program flexibilities, as well as the rising cost of food and food insecurity, as food insecurity continues to climb, as advocates, we play a vital role in helping individuals and families access nutritional supports they need to determine the health and well-being. Complementary to our work is our partnership with the Department of Human Services. As the leading agency addressing human service needs across the district, we depend on DHS to provide expert level support to the advocate community, who in turn works to provide direct service to the community at large. I want to start out by saying that I extend my deepest gratitude to the Economic Security Administration as they continue to work through the large number of caseloads, limited staff capacity, and limited access to funding while navigating the implementation of new programs and initiatives, excuse me. I'm happy to share that the improvements that we have experienced in response times when submitting case status inquiries, where CSIs in previous months would take several weeks for a response to be issued or acknowledged, we are now receiving completed cases with resolved issues in a timelier manner. As of late, for our most complex cases, we have received a resolution on average 2 weeks. We have other members of the ESA division that ensure a timely response to our CSA submission. For our most complex cases, it's typically about 2 to 3 days. We'll receive a response back from that team. While we celebrate the improved response times when submitting requests for applications on behalf of our SNAP clients, we are still concerned with the application processing time as they're processed, as well as the CAPERS rate, which you alluded to earlier this morning. Far too often, we hear from district residents who submit their application, recertification, or mid-certification documents via District Direct, but experience extended periods of time before they receive a response on the status of the application, leading to a delay when benefits are received. Additionally, when speaking to SNAP clients, we continue to hear of instances where notices are not received or contain inaccurate information. Most recently, I spoke with a mother who received a notice regarding pandemic EBT, which is currently not even being administered, causing confusion, especially as the district launches summer EBT. 2 very distinct, different programs. Fortunately, this was a minor instance and was able to be corrected swiftly. District Direct remains a valuable resource for district households to apply for benefits, view notices, as well as payment information. We are grateful for the investments made to ensure SNAP clients have access to a streamlined process for accessing their benefits. However, one of our barriers also includes language access. We continue to receive requests from our limited English-speaking SNAP clients regarding instances where they have not received notices in the correct language, resulting in a loss or termination of benefits. There are several options which we believe will lead to a greater improvement of District Direct. One of which is allowing residents to complete a change in circumstance form online. District Direct has been proven to be a valuable tool that enhances the accuracy, convenience, and efficiency of benefit administration. Allowing this functionality will ensure that residents receive the appropriate level of support based on their most current and accurate information. By allowing residents to report changes in real time, the online form ensures that any modifications to income, expenses, or household composition are promptly reflected in their benefit calculations. This minimizes delays and ensures that benefits are adjusted accordingly and quickly. Other outstanding challenges that continue to arise from clients include verification documents as they are submitted to District Direct, often left in waiting for approval status while households are sent notices or even terminated for failure to provide documents. Lastly, I'll just say, a more robust, accessible, and efficient District Direct portal is a crucial tool in addressing many of the challenges. This should be paired with increasing staff funding, training for our DHS staff. Thank you for the opportunity to provide testimony as well as your time and attention to this matter.
Thank you. Ms. McClellan? Ms. McClellan, you're on mute.
Good morning, Chairperson Henderson and members of the Committee on Health, and Chairperson White and members of the Committee on Housing. My name is Stephanie McClellan, and I am the Deputy Director of DC Kin Care Alliance. The mission of DC Kin Care Alliance is to support the legal, financial, and related service needs of relative caregivers who step up to raise children and their extended families in times of crisis when the children's parents are not able to care for them. I'm pleased to testify today regarding the experiences that I, and more importantly, DC Kin Care Alliance clients have had applying for benefits in the District of Columbia. This testimony is an abbreviated version of the written testimony I have submitted, and I ask the committee members to refer to my written testimony for important history and context. Here in the district, approximately 22,000 Black and Brown children are living in kinship care arrangements, representing about 20% of all district children of color. The relatives who raise these children are primarily Black women who live in wards 5, 7, and 8. They often live at the economic margins of our society even before they are called upon to raise a relative child. Many also report a significant disability. Benefits applications, whether on paper or through District Direct, are complicated and burdensome, leaving many caregivers to give up. The District Direct software is often glitchy and will kick you out of the system, so you have to start over. Sometimes I get error messages when trying to log in. Sometimes the software does not provide a way to do things that you need to do. Most recently, we have been stymied in assisting caregivers to add children to their Medicaid cases by filing a change of circumstances, a much shorter and more condensed process. Instead, we've been forced to help relative caregivers file new applications for Medicaid for the children, if the system will even let them do that. Even in those situations where we are able to complete the application or change of circumstances online, often it is not acted upon within 45 days and we have to file a request for fair hearing. In other cases, the application is processed, but the client is improperly denied benefits and we have to file a request for fair hearing regarding the improper denial. Rarely is the application both timely and properly processed and the client receives the benefits to which they are entitled. That particular outcome has happened for us only once in the past year. Another problem we see frequently is that a client who has been receiving benefits suddenly stops receiving them. Sometimes there's no notice at all. Sometimes there's a notice, such as a failure to recertify, even though the client has already recertified through District Direct. Again, we file for fair hearings for these clients and it eventually gets sorted out until next time, but the problems caused to our clients while they are waiting can be catastrophic. I currently have a client who was terminated from SNAP with no notice at all. Of course, I have filed a request for fair hearing on her behalf, but this case is particularly galling because she had just settled a SNAP fair hearing case a few months prior. The client had received her back benefits and only one regular monthly payment before her SNAP benefits were terminated again. A watershed event occurred as a result because she was forced to use money intended for utilities to pay for food, which in turn caused her to get behind on her utility bills and receive a shutoff notice. We helped her get on a payment plan, but this never would have happened if her SNAP had not been wrongly terminated. What I tell clients now when we apply for benefits together is that they should expect the process to last about 3 months, 45 days for the application and 45 days to actually get it done through a fair hearing request, and to be pleasantly surprised if it happens sooner. I have the following suggestions to improve District Direct. The online combined benefits application should be made easier to use by significantly limiting the number of questions that require an answer before you can move to the next page. People should be able to submit applications even if they cannot answer every question, and DHS employees should follow up with applicants who submit applications with missing information. 2, combine the two software systems, District Direct and the processing software actually used by the ESA, into one integrated system. If two separate software systems actually are necessary, the software system used by DHS employees and the District Direct software need to communicate with each other better. I have more than once spoken to a DHS employee at the call center and told them that something they needed had already been submitted via District Direct, only to have that employee tell me that they don't even have access to District Direct. Prioritize training at all levels, including supervisory, in the processing of applications and recertifications, so that filing for fair hearings is only required in rare instances, not as a matter of course. If that is not possible, designate a smaller number of employees with specific expertise in relative caregiver applications. Thank you for your consideration of these important matters, and I'm happy to answer any questions.
Thank you. Eric Romero?
Good morning, Chairperson Henderson, Councilmember Robert White Jr., council members, and council staff. My name is Eric Romero, and I am honored to stand before you today as an intake and benefits specialist at La Clínica del Pueblo, a federally qualified health center providing health and community services since 1983. I am grateful for the opportunity to discuss concerns regarding the Department of Human Services performance related to the DC Alliance program. As an intake and benefits specialist, I am responsible for providing information about various health insurance programs, determining eligibility and assisting patients and completing the required applications. In my role, I often encounter repeating administrative and technical issues that hinder patients from accessing their DC Alliance benefits. Today, I would like to emphasize that despite the extensive services and support offered to residents by the district, the Department of Human Services complexity requires extra support for community members and by extension, the intake workers who assist them to apply for, access, and appeal a denial of services. DHS and its siblings agencies must improve customer service, become efficient, and work together to better serve district residents. One of these issues we constantly find is inconsistent information in the DHCF provider portal. When our patients go to the ESA office, they are told their insurance is active, but when we look in the portal, we see a message saying that they are not eligible. And to make it more confusing, the recertification date shows that the patient's renewal is not until 2025. I would also like to note that many of our patients who go to the ESA office to ask for help report feeling mistreated, and many of them say they did not receive interpretation services. Another prevalent issue is the inconsistency and lack of clarity with group applications. When I submit family applications for DC Alliance insurance renewal, some family members are approved while others face unexplained denials. Additionally, despite many patients receiving yearly certifications, some only get a 6-month renewal without any explanation. In addition, a recent issue we have encountered has been that some patients who have been approved for DC Alliance benefit do not get an MCO assigned in the system. Since MCOs are where the payments for services come from, patients will often show up for their medical appointments only to be told that their appointment has been canceled because there is no payment method on file. And in the cases where appointments are not canceled and patients receive medical services anyways, the patients themselves will likely be sent a bill which they oftentimes cannot afford. It is not only affecting our patients' health, but also impacting La Clínica's bottom line. We have brought up this issue with our weekly DC Primary Care Association meetings and found that other federally qualified health centers have also been seeing DC Alliance patients with active coverage not being assigned an MCO. We have not received clear guidance on how to handle the billing of these patients without an assigned MCO. Unlike Medicaid, DC Alliance patients are not eligible for retroactive coverage. This means that once their MCO is eventually assigned, they will not be covered for medical services during the period where they did not have an MCO. La Clínica has continued to provide services to these patients anyways, and if retroactive coverage is not given to them, then La Clínica will have to cover these costs. These are just a couple of examples of what many of our patients go through when trying to renew their insurance. Many of our patients suffer from chronic conditions, and lapses in their care are detrimental to their health. The management of chronic conditions require timely medication adherence and constant communication with primary care physicians and specialists. The DC Alliance program is one of the most vital benefits that extends access to low-income immigrants who do not qualify for Medicaid. People who need services should not have to find legal or social work support for access, applications, and appeals. DHS must improve their system and intergovernmental coordination. Before the council considers the budget for fiscal year 2026, there must be measurable progress made towards efficiency. Thank you very much. Again, my name is Eric Romero.
Thank you. Ms. Miles Lee.
Hey, good afternoon. My name's Allison Miles Lee. I'm a managing attorney at the nonprofit organization Bread for the City. Most of our clients and medical patients rely on DHS for critical public benefits programs such as food stamps, TANF, Medicaid, and Alliance. I thank council members White and Henderson for convening this roundtable. Although the district provides residents with many services and supports, DHS complexity and red tape require legal or social work support to apply for, access, or appeal a denial of services. DHS and its sibling agencies must improve customer service, become efficient, and work together to better serve district residents. When we testified in 2023, we raised concerns about technical problems that Bread for the City clients experienced while accessing District Direct, including requests for unnecessary or duplicative documents and glitches that prevented people from completing applications and recertifications online. These issues persist. Back in 2023, we were concerned about unrepresented customers who would not be able to resolve problems on their own without a lawyer or other advocate. But at that time, advocates enjoyed a relationship with DHS that allowed us to resolve individual customer issues in a timely way. Now that system has become strained. Here's what the process to resolve a benefits matter looks like for us now. A client reaches out to an advocate when there's a problem with their benefits. The advocate is able to access the client's District Direct account and confirm that an error did occur. For instance, an application was not processed in time, or a client's benefits were terminated with no advance notice. The advocate then can download the documents and screenshots that show the error and sends an email to our contacts at DHS explaining the situation. Often, the advocate will send a number of follow-up emails to DHS without ever receiving a response. If the issue relates to Medicaid or Alliance, the advocate will email a contact at DHCF. The DHCF contacts do respond promptly, but they say they're stuck trying to follow up with DHS, which is the entry point for applications and recertifications. During this limbo period of waiting for informal resolution, we often try to move things along by filing a fair hearing request at OAH. OAH is experiencing a backlog of public benefits cases, as you know, and it may be a month or more before the hearing is scheduled. Before then, an administrative review conference, ARC, is scheduled with DHS. During the ARC, we find that DHS hearings examiners often try to resolve the issue, but they appear to get stuck on what they call remand. At the first hearing before a judge at OAH, another player from DHS gets involved, called a policy analyst. That person generally has not reviewed the case at all and has not communicated with the ARC hearing examiner. This inevitably leads to a continuance, pushing the matter out even further. Advocates and their clients may have a number of additional hearings before the matter is finally resolved, all by agreement. I was deeply saddened to hear Mr. Fernandez Bernal's testimony earlier today, having to endure health struggles while his Alliance application languished, but I was not surprised. His experience is unfortunately shared by many of our clients. In one particularly egregious case, our client, Ms. K, stepped in to provide a home for her teenage niece and nephew in November 2022 after her sister suddenly passed away. She was already caring for 2 children of her own who received DHS public benefits. Ms. K sought to add her niece and nephew to her benefits household as soon as they came to live with her. She encountered numerous roadblocks with DHS, though, and the children were never added. Ms. K finally came to our legal clinic for help in 2024. When she began working with us, she had already attempted to add the children to her household at least 5 times, online. No changes had been made. Even once she was connected to legal assistance, it took us an additional 4 months for Ms. K's niece and nephew to be added to her case, including several hearings at OAH. All in all, more than 18 months passed between the time of her initial report of a change in circumstances and the actual processing of the change. Ms. K ultimately received more than $11,000 in uncontested back TANF and SNAP that DHS agreed she was entitled to for her niece and nephew. Those were resources that were not available to her at the time she was actually providing the care for the children. Going to OAH to resolve undisputed district direct issues is not an appropriate use of that tribunal. OAH judges are tasked with resolving disputes between a government agency and a customer, not with babysitting a case or pressuring DHS to do what it agrees it needs to do. This testimony is not intended as a criticism of specific DHS employees. However, well-meaning and very competent DHS staff in high-level administrative, hearing review, and policy analyst positions are spending far too much time dealing with issues that should be easily resolved. We're very concerned about DC residents that are not working with a lawyer or other advocate to resolve their issue with DHS public benefits. DHS must improve their systems and intergovernmental coordination. Before the council considers a budget for fiscal year 2026, there must be measurable progress made toward efficiency. Thank you.
Thank you so much to this panel of witnesses. You certainly brought up, I definitely heard themes, excuse me, and the things that you brought up. Mr. Romero, I wanted to start with you. It's not the first time that we've heard some language access issues, but I think you're saying specifically, even when someone goes in person, they're not able to receive translation services. Is that accurate? If they go to like a service center?
Correct.
Okay. And to what extent is the DHS staff person's response on that front?
Well, they tell me, patients tell me, they just say that they just don't provide any Spanish-speaking services.
They said they don't provide any Spanish-speaking services at the DHS service centers, even though it's required by law. Okay. We can follow up with DHS on that front. Ms. McClellan and Ms. Miles-Lee, I think you both have similar stories around the challenges with clients trying to file specific change of circumstance issues. Is that that particular type of case fairly unique, or are you also seeing similar challenges in individuals who are applying perhaps for benefits for the first time?
I can just say, since we deal with a wide range of different family types, it's not unique to these families that have non-traditional family structures, but we definitely do see more difficulty reporting changes and getting changes acted on when there is a non-traditional family structure, like a grandparent trying to add a child. But it does happen with other families as well. I have a pending change of circumstances that I filed in April for somebody who tried to report that she was no longer receiving child support that hasn't been processed.
Since April?
Yes.
Okay. Ms. McClellan, I don't know if you want to add here.
Yes, I also was struck by the similarities between Ms. Miles-Lee testimony and my own. Everything she said is exactly what I experience and exactly what my clients experience. With regard to whether we have the same issues applying for new benefits versus change of circumstances, yes, they're the same in the sense that we have both software and human caused error issues, but the actual issues themselves are different. With the change of circumstances, we certainly face more problems on the software end, but it's by no stretch of the imagination unique to that. For example, let's say I have a relative caregiver client who is trying to apply for child-only TANF or for cash assistance for children because she can't prove that she's related to the child. And she goes to try to do that online using the combined benefits application. Despite the fact that her income and the rest of the household's income is not taken into account when calculating those benefits, it's only the child's income, for example, survivor benefits, benefits or disability benefits that would be taken into account on that application, she is required to enter her income and the income for the entire household in order to complete the application. It is required for that to be filled in for her to even progress in the application to the next page.
And then
So
wouldn't that
she's
be a
left with-
challenge? I would say that that probably could lead to confusion on the staff side for processing, because now someone could make a mistake and count her income when it shouldn't be counted.
I
right?
cannot tell you how often that happens. I would say that most often, what we see is just a failure to process the application or the change of circumstances at all. That's just the most frequent result. We mark on our calendars when the 45 days are up, and then we file for a fair hearing at the end of the 45 days. The second most common outcome is that benefits are improperly denied. With or without notice, and the notice may or may not be accurate, but we at least see either by talking to someone at the call center or receiving a notice that the benefits were, somebody actually did at least look at the application and those benefits were improperly denied. With regard to the third most likely outcome, that is just having it processed accurately and the person receiving benefits, which is rare enough that it is cause for celebration when it happens in our offices.
Thank you. Thank you for that. And I'm over my time. Thank you. Councilmember White.
Thank you, Chairperson Henderson. Let me start with folks who are online. Stephanie McClellan, you mentioned several things in your testimony with the software glitches, error messages when trying to log on. I just want to confirm this is with the new system. Is that right?
This is with District Direct.
District Direct. Okay, that's right. You also mentioned some specific recommendations in your testimony. Have you given this feedback to the agencies, given these directions, recommendations to the agencies?
I will say that we have had some positive response when we make policy recommendations to the agency. We have worked with Brian Campbell in the past on policy recommendations. And specifically with regard to District Direct, we have email communications with the contractors who deal with these software glitches. And quite frankly, sometimes they're able to help us and sometimes they're not. Sometimes it's just, a system-wide issue, the system is down, whatever the reason is, with a glitch happening and being kicked out of the system or not being able to log in. That's not something that's been able to be resolved. We have presented to them some issues where we've been able to share screen with them and show them, okay, this is what happens where we get to this point in the process and we can go no further because of a glitch. But other times, we've just been told flat out that that's not a problem we can solve. For example, the example
I'm
that
sorry, what I'm trying to get at is whether the agencies have a space, or so you all deal with a lot of clients and so you're seeing recurring issues. I'm trying to determine if the agencies have space for that feedback so that they are incorporating it into their work internally or their work with the contractors so that you eventually have to do less of this one-off working through issue. So is there a space that you're aware of for you to give this feedback of the consistent issues you're seeing to the agencies directly?
No, this is
Okay.
it.
Or we need to work on that. Cannot improve without feedback, and feedback just won't really happen without the agencies creating that space. So I appreciate you bringing it to us. So we will help in that respect as well. For Eric Romero, I appreciate your testimony as a intake and benefit specialist. Similar question to you. Have you given your recommendations and thoughts on how to improve the system to our agencies?
That I have not done.
Is that something you would be willing to do if there was an opportunity?
Of course.
Appreciate it. Allison Miles Lee with Bread for the City. You mentioned something we heard from another resident earlier, which is frustrating. The idea of sending a lot of follow-up emails to DHS with no response. Are you emailing a specific person or are you emailing a general email account?
So generally, we're emailing the DPO .deputy email, which is a email we've been told to use to resolve these issues. And I will say DHS has made some spaces for advocates to give feedback. Primarily Brian Campbell kind of is the advocate facing person and always will meet with us, right, to hear us out. I appreciate having the opportunity to continue to raise these issues before the council as well. But I do feel that, DHS has been open to suggestions. For instance, my complaint about how many different people are involved in this stage is going up to a fair hearing. There's been some talk about maybe having the person who does the ARC be the same person who attends the hearing. So at least there's some continuity and we're not starting all over again, just as an example.
That's great. I appreciate it. I'm glad DHS is making that space. Last two questions very quickly. LaMonica Jones, this language access issue, I just want to make sure I understand. Is this people who speak the same language, let's say Spanish is their first language, one person will get a translator and another person speaking the same language will not be able to access a translator? Is that right?
So in terms of translation services, that's a different issue. So we're able to provide support through translation services on our end. So if we have a Spanish speaker, or Amharic is actually the second language that we have the most callers in, we have the ability to utilize translation services, which will provide them assistance. Our specific issues in terms of District Direct are oftentimes we will have those that where English is not their first language, they will receive a notice in English, which is different than their first spoken language. Right. So if they are Amharic or Spanish speakers, they will receive a notice in English. They're unable to understand it, which then leads
No, I
to.
understand that point, and I apologize for interrupting, but will some people receive the notice in Spanish or Amharic and some people will not?
Some do. It's
Okay.
not across the board that everybody has an issue when it comes to receiving a notice in an improper language, but there are cases that we hear more often than not where those where English is their second language do not receive the notice in their correct spoken language.
Okay. Chairperson Anderson, could I ask one last question? I appreciate it. I'll close out. Nadine Coy, similar questions to some of the other folks, given your experience and the work that you all do. What are the most common issues that your clients face? Of issues with the system?
To the point, one of the things that we identified in, the collaboration throughout since December through April, the communication, the letters that go out, the timing of when they go out. That's an area that we worked on and we collaborated on how do we change some of those timelines so it gives the beneficiaries more time to be able to respond. So the communication is important. That's going out with the instructions, the timing and the messaging.
I appreciate it. Well, thank you so much. Thank you, Chairperson Henderson. I apologize. I'm going to rush out in a couple minutes.
Thank you, Chairman White. One question I just wanted to ask. They're getting ready to start the interview process or incorporating the interviews back into the process in October. We used to do this before and then we stopped during the pandemic. Are there if you had to pick one thing that you would recommend to DHS as they begin to roll this out to help make it more I'm not gonna call it seamless because it will probably never be that, but to have this whole sort of change happen smoother, what would that be?
Honestly, I would see if DHS has the ability to go to USDA and ask for an extension on that waiver. We realize that although the interview process may be beneficial in some aspects, we're anticipating that the various challenges that come with having to go back in person and schedule that interview may be a bit challenging for some residents. And so as we try to maneuver through other different aspects of timeliness of our CAPERS rate, if there's an ability for DHS to actually ask for an extension on that waiver before it rolls out in November, also understanding that FNS has said that, no, this is a hard stop, that there's nothing that they could do. But if they do have the ability, considering where the district stands in terms of its CAPERS and timeliness issues, if they can ask for an extension on that waiver rollout, that would be ideally a step number one.
Does anyone else have any?
Yeah, I was going to say, I think DHS needs to start sending out outreach materials now saying this is happening. You need to do this or you won't get your benefit, or you'll lose your benefit if you're currently getting them. There have been so many changes during the pandemic where things were announced and then rolled back that our clients were never sure whether something was actually happening or not. So in particular with like Alliance recertifications, they started up and then DHS stopped requiring that again, then they started up again. So I think messaging now going out to everybody, if they can do a text message campaign, robocalls, in addition to written notice, it's really important to start early on that. And retraining of frontline staff on language access and the need to provide interpretation.
Yeah, that part definitely came through very clearly. If we're going to do the in-person interviews, if someone isn't there to help, then that's just more time. Ms. McClellan?
My recommendation would be training, and more training, not just of the frontline staff, but also of their supervisors. My experience is, yes, the software is glitchy. Yes, there are problems with the software, but by far the most problems that I see are caused by caseworker error because they don't know how to process relative caregiver applications correctly. And this idea that somehow interviews are going to be a solution to that, to me, doesn't make any sense. What I envision happening with things as they are right now is that caseworkers will be making mistakes in person instead of doing it in writing. And that doesn't help anybody. It just leads to even more frustration on both sides. And again, this isn't a slam on the workers. I'm sure it's just as frustrating for them to not be able to do their job correctly as it is for our clients to not be receiving for those benefits. Nobody wants to do their job wrong over and over again. So people need to learn how to use these systems and to apply, the rules in the policy procedure manual as they are.
Thank you. Thank you so much to this panel of witnesses. Thank you so much again for being flexible on your time today. All right, we're going to go to our last and final panel. Haley Hoff, Swapana Yurley, Patricia Quinn, and Monique Malazia. Okay, I see Haley when you're ready.
Good afternoon, council members and staff. My name is Haley Hoff, and I'm a staff attorney at Legal Aid DC. Thank you for the opportunity today to discuss the DC Access System, commonly referred to as DCAS. DCAS currently creates significant barriers that prevent district residents from receiving benefits that they are lawfully entitled to. The system is prone to errors at key junctures, including when recipients apply, recertify, or report changes. And these errors often go unnoticed by the agency unless the recipient brings DHS's attention to the issue. The result is that residents are deprived of benefits, while DHS is often in violation of legal deadlines dictating specific timelines for processing applications and changes that impact benefits. An error-prone computer program is not an excuse or exception to these deadlines, and errors in DCAS that result in benefits being withheld have potentially disastrous consequences for public benefits recipients, as we've heard today. Legal Aid receives many applications for assistance per week related to DCAS errors. For example, since oversight testimony in March, we have seen a disturbing new trend in which Medicaid recipients have their benefits terminated after DHS incorrectly alleges that the recipient is deceased. DCAS also often fails to increase benefits when a beneficiary reports a new household member or a change in income is reported. And issues frequently arise at the initial application or recertification stage, where DHS fails to timely process paperwork, resulting in zero or incorrect benefit amounts. And even when these errors are corrected potentially months later, the impacted recipients and their families are not made whole. District residents go hungry when DCAS prevents them from obtaining their full SNAP entitlement. Families face housing instability when improper withholding of TANF benefits prevent them from paying rent, and district residents have to forgo treatment or cancel medical appointments when DCAS prevents them from accessing Medicaid coverage. For these reasons, we recommend urgent changes to improve the administration of DCAS. First, DHS must improve the currently ineffective mechanisms they use to identify and address errors. DHS cannot continue to wait until a recipient brings an issue to their attention, and wherever possible, the system should be programmed to automatically flag cases that appear to present errors in order for staff to review. For example, the system could flag when a resident has uploaded a document or input information that has been pending for longer than the allotted processing period. Or similarly, if a case on DCAS has a recertification pending, there should be safeguards in place to prevent the system from terminating for failure to recertify. And next, when an issue occurs and the benefit recipient is the first one to identify it, there must be an effective, streamlined way to bring the system error to the agency's attention. For example, a separate phone line exclusively for system errors. And in tandem with this, DHS must have better procedures in place to quickly address and correct the system error. As it currently stands, recipients have no efficient system to flag and resolve the DCAS issues that impact their cases. Recipients contact the call center or service centers repeatedly, but are not connected with anyone who has the authority or ability to correct the DCAS issue, and are repeatedly informed there's a system issue, but can't obtain clear next steps on what will be done to fix it. And even if a recipient files a fair hearing request, cases can take months to resolve or longer if they're representing themselves. Legal Aid recommends that the council and administration put in place the following policies and processes to address the above issues. First, the council should authorize and fund the creation of a DHS ombudsperson. This ombudsperson would be a public-facing role who recipients could contact about DCAS-specific issues and who would help oversee and facilitate the resolution of these issues in accordance with applicable timelines. And second, DHS must develop protocols to ensure benefits are not unlawfully withheld while the DCAS problem is being resolved. For example, a manual override after a certain time period has elapsed that ensures benefits are issued on time via alternate methods where they can't be issued on time by DCAS itself. We don't believe that DHS does not care about our clients, nor do they want individuals to go hungry or lose access to health insurance. But while it may be difficult for bureaucracies to make improvements and implement them effectively, our suggested changes and the other changes listed today are urgently needed. We really appreciate the council's commitment to providing this oversight of DHS and DCAS and urge the council to continue playing this important role, and want to thank the council for allowing us time today to discuss these important issues, and we look forward to working towards solutions in the future. Thank you so much.
Thank you. Ms. Gurley?
Thank you. Good afternoon, Councilmember Henderson and Councilmember White. Thank you for convening this hearing today. My name is Swapni Lurie, and I'm a senior attorney with Legal Counsel for the Elderly's Economic and Healthcare Security Practice. Thank you for allowing me to provide testimony on behalf of LCE and DHS on the DC access system, also referred to as DCAS. I'll focus my testimony on LCE's interaction with DHS while helping our clients navigate the application and the appeals process for SNAP and ERAP. LCE provides free legal representation as well as social work services to low-income residents of the district who are 60 years of age and older. Also, although the district provides residents with many services and supports, DCAS's complexity and red tape require both legal and social work support to apply for access or repeal a denial of services. DHS and its sibling agencies must improve customer service, become more efficient, and work together to better serve district residents. LCE works every day to navigate the DCAS access system, DCAS and agency appeals to help clients secure benefits, but are continually met with frustration, failure, and as well as finger pointing. Regarding the ERAP application process, DHS only accepts applications at the beginning of each fiscal quarter until the system reaches its preset quota. And the best way to apply is through the online portal. DHS has also provided a phone number, but that really functions well in our experience. And therefore, our attorneys, we hesitate to recommend that phone number to our clients. The quarterly portal is usually problematic. On January 2nd, the portal opened at noon and closed within a few hours after district residents submitted about 3,500 applications. The April 1st opening was the smoothest one that we had this entire fiscal year. There were issues with the portal when it first opened, but it ultimately remained open for over a week. But that was also likely because DHS accepted over 8,000 applications during that quarter. Portal problems returned during the July 1st opening yesterday when, after logging on, applicants were placed in a waiting room and were notified that they would have to wait anywhere between 8 hours and up to a day before they could apply. These problems can and should be addressed. Now, discussing the SNAP application process, that's been no less onerous. A beneficiary can apply for SNAP by completing an application, providing some documents to verify eligibility, including proof of rent or mortgage payment, proof of DC residency, and proof of income. DHS then interviews the applicant. DHS did waive the interview process due to COVID, but will likely resume in October. And then while they're receiving benefits, every household must then complete a mid-certification halfway through the certification process. And this allows DHS to adjust based off of any changes to information provided on the application, including income or address. While this process is necessary to ensure that those who need benefits qualify, DHS still has frequently been sending multiple conflicting notices simultaneously with incorrect deadlines for recertification, incorrect documents required for recertification, and benefit approvals. And beneficiaries as well as advocates must guess on what SNAP benefits are going to expire, when they're going to expire, and what DHS requires of the beneficiaries in order for them to be able to re-enroll, and to understand what steps DHS needs for them to take to be able to be re-enrolled. DHS's disorganization means that recipients are going months without access to the food assistance they need. And so LCE reiterates here a main point from our previous testimony that district residents should not have to require legal representation in order to secure their benefits. And DHS's disorganization goes beyond the application process. DHS seems to have difficulty approving or denying SNAP applications, notifying residents of their status, or notifying residents of their benefits level. Repeatedly, DHS has approved or denied applicants for benefits beyond those that they even applied for. They've instructed beneficiaries to renew benefits shortly after they got their initial approval, or they've been given corrected benefits, but with incorrect calculations. These SNAP and ERAP errors are barriers causing significant financial, mental, and physical harm for our beneficiaries. Regarding SNAP, often these beneficiaries try to represent themselves pro se during the appeals process. And unlike LCE clients, pro se beneficiaries feel a greater impact because they don't have direct contact with the Economic Security Administration's upper administration to be able to push for quicker remedies or have access to advocates to spend hours trying to correct DHS errors. ERAP beneficiaries face the threat of eviction and financial strain while they wait for the opportunity to even apply for benefits. The district spent hundreds of millions of dollars on the DCAS only to have persistent problems applying and problems connecting with the relevant agencies to remedy these problems. DHS and the sibling department and agencies' answer to these issues have been significantly finger pointing. Now is the time for the council to conduct a systemic review of the of DCAS to help ensure that those residents who need these programs can get them. And our written testimony will provide more suggested improvement. In conclusion, before the council considers the budget for the fiscal year 2026, there must be measurable progress and a systemic review of the application process for DC public benefits. The current system only produces frustration, finger pointing, and failure. People who need services should not have to find legal, social work support for access, applications, and appeals to public benefits. DHS must improve their systems. Thank you again for giving me the opportunity to be able to testify in front of you today.
Thank you. Ms. Quinn?
Good afternoon, Councilmember Henderson, Councilmember White. Thank you for the opportunity to speak today. My testimony is really brief. It's 3 main points. One, I want to start with DHCF has made unprecedented efforts to support beneficiaries and help them to comply with the requirements of redetermination. They are committed to ensuring that every eligible resident is able to access and receives and maintains health insurance coverage. But the second point is DCPCA has recommended to DHCF that health centers be granted authority to presumptively determine eligibility for health center patients. The presumptive eligibility authority exists right now if hospitals choose to avail themselves of it. It has not been made available to FQHCs to date, but they do a tremendous amount, as you heard from Mr. Romero earlier, they do a tremendous amount of support for beneficiaries in terms of application completions, et cetera. And giving presumptive eligibility authority to the community health centers, we think could really make a change for the pathways for their patients to get and keep health insurance coverage. We understand that DHCF has said that they are willing to move in that direction. We understand that it requires some changes to DCAS that would allow health centers to be able to activate coverage. We have DHCF's commitment to move forward, and we look forward to coming back to these committees to share progress in that regard. Mr. Romero also raised our third point, which is that earlier on in the renewals, particularly for Alliance, a number of Alliance beneficiaries were granted coverage without being assigned to an MCO. That is problematic because the only way for health centers to bill at present for services is through MCOs. So that means that some Alliance beneficiaries who had coverage, there's no current way for health centers to bill those visits. They've been sending the claims to DHCF at DHCF's request. We understand that DHCF is preparing a recommendation for how to pay those claims. And we look forward to reporting a positive resolution to council soon. But again, we look for presumptive eligibility authority within the health centers and a concrete strategy for paying Alliance claims when there has been no MCO assignment. Thank you.
Thank you. And Ms. Malzia?
Good afternoon, Chairperson White and Chairperson Henderson. My name is Monique Malizia, and I am the TANF Power Coordinator at DC Safe. I advocate for survivors and domestic violence in this criminal and civil systems, housing and mental health sectors, as well as navigating the work and school requirements for TANF. DC Safe was entrusted with the district's domestic violence program on work employment and responsibility, otherwise known as POWER, in the 2018 fiscal year. I receive external and internal referrals for the program. If a client is experiencing domestic violence and is unable to go to work or school, meet with their TANF vendor, they can enroll in DV Power for a 3-month exemption period from those responsibilities. Clients can access DC Safe's advocacy, crisis response, and shelter teams during this period. In addition, I make monthly calls to see how the client is doing and if any issues with their benefits arise. Unfortunately, we are aware of many. I'm here today to discuss the common challenges and patterns our clients experience when working with DHS for public benefits. In March, I started working out of DC Safe's shelter once a week to meet with clients. Clients who needed support with filing benefits applications often had multiple application submissions on the District Direct app without follow-ups. There is a severe lack of support for customers who do not speak English. The application submission portal, District Direct, only offers English, Amharic, and Spanish language options, leaving customers of other native languages without support. Applying for benefits in person sometimes was not an easy solution if the client could not speak or read English. In the 2 years that I've been running DV Power, I have not received any referrals for non-English speaking TANF customers. I primarily work with TANF customers, but since clients have trouble reaching DHS staff members on the helpline, I will reach out to my contacts at DHS for status updates on SNAP as well. Without our partnership through TANF, our clients would not be able to resolve some of the confusion around their application holdups or be able to get firm responses about how to resolve it. Due to a massive backlog, clients often experience an automatic closure of all of their DHS benefits during their yearly recertification, including TANF, SNAP, and Medicaid. Many clients I spoke with could not provide food or gifts for their children over their winter holidays. Understandably, clients in this situation felt frustrated and alarmed, which exacerbated their already vulnerable state. We had been advised to tell clients to either persistently call the helpline, which has notoriously long wait times, or visit in person, which brings its own accessibility challenges. This is clearly an issue on the DHS side, but it's causing our clients and other residents to do hours of extra work, never mind the emotional toll. I had a client whose benefits were turned off after recertifying. She was told that her 16-year-old son had to complete an assessment as to why he was not working. Her son said that he was in school and wanted to focus on his studies, and my client was then told that her son never had to fill out that paperwork. She had called, gone in person, and emailed with multiple staff members and still does not have a clear answer as to why her case was closed. I've also noticed that a lot of TANF customers had their cases closed when their child turned 16. DHS requires updated attendance records, and when clients sent them back, they did not have their case reopened for months. One parent was upset because she was unable to help their child get ready for the prom, on top of paying for food and rent. TANF customers are sanctioned if they are not in compliance with the Child Support Office. Our clients have applied for benefits and checked off the box that it is dangerous if they provide the other parent's information. Clients are told to talk with the Child Support Office and then are redirected back to DHS. The child support sanction can subtract more than $100 off of a client's monthly TANF amount. Clients have not been given clear solutions from either office on how to resolve this issue. DC Safe and Legal Aid's Benefit Division have come together to create a referral system so that clients are able to discuss next steps on getting their cases reopened, as well as receive their back pay that is owed or trying to lift sanctions on child support. Legal Aid suggests that clients get receipts whenever they go in person and take screenshots of form submissions on the District Direct app or website. Many clients have said that the District Direct app does not save submissions or that it crashes. DHS and Legal Aid have discouraged clients from mailing in documents as well because the forms will get lost. I thank you for your attention and consideration on these matters. I'm available to address any questions you may have. Thank you for your time.
Thank you so much to this panel of witnesses again. Lots of similar themes arising in terms of how you all are showing up and representing for your clients and the work that it is taking on behalf of your organizations to see results. Ms. Guillory, I think the statement that you made of district residents should not need legal representation to access benefits was a singular strong one, right? Like, I think that's the whole goal of why we're here, of why we're doing this work, and why we continue to underscore. Like, you shouldn't need a lawyer to be able to get through the application process. And yet you all have example after example that, but for your intervention, your clients would just be, they wouldn't be able to even get the answers that they're looking for. Is that accurate?
Yes, Councilmember Henderson. EESA has been extremely helpful for addressing issues, but that's after our clients have attempted to go on their own and have failed after weeks or months. And then they've come to us and, you know, things have progressed significantly with ESA in being able to assist us. But, you know, even with our assistance, it might still take them several weeks. So at this point, it's taken this client about several months to get this rectified. And, you know, they shouldn't need our assistance to get some things, some simple things such as getting their house members, the number of household members changed. It shouldn't take 3-4 months to be able to do that.
So let me ask you all this, the four of you, who, I guess, Ms. Quinn's a little bit different because she's representing the Primary Care Association, but nonetheless, you certainly see patients from the Medicaid side of things and probably hear some of the complaints that they get. In your estimate, like in your analysis of the root of the issue, do you think it's the system or is it a people problem? I think that was like, one of the underlying things that we were trying to get to with the executive, and they'll say, oh, it's both. But I don't know, the more I'm hearing, the less I'm thinking the software is the main issue here.
I can speak quickly to that. I do think that there are recurring issues that we see over and over again that are happening within the DC access system. But I think there is, like what you're saying, an unresponsiveness on the part of the agency to then fix these issues when we bring their attention to the problems. So I think it is a both and situation. And I think it's so frustrating for clients to then call the call center and say, I'm having this problem with the system, and then be told, we actually have no way to fix this, and someone will follow up with you, and then someone never does. It's really discouraging. So I think it is both a systems and a people problem.
Councilmember Henderson, I think if we moved to do whatever system changes needed to happen in order for health centers to do eligibility at the center, we might learn a lot about that question. Is it a system glitch problem, or is it a training and personnel problem? I think health centers would dive right in and come to the table with what are they seeing once they have the authority to go into the system and activate coverage. They're already doing a ton of assistance to their patients in terms of properly filling out forms. And it's the health centers, all these, my fellow panelists, what they're describing is what health center staff experiences at times with trying to get their patients coverage. And I think moving to presumptive eligibility within the health centers at the very least would give us new insights into how the system is or isn't working.
Okay. I want to ask the same question I asked the last panel as we go to back to interviews in October. If you had one recommendation, what would that be?
You already have mine.
Yes. Anyone else?
I think being able to work with ESA and DHS to figure out what the appropriate way to give these notifications are. I know we have started conversations regarding that, but I think having, just really being able to say, like, working with clients that have disabilities, language access issues, like how far in advance these notices needs to go out, what happens if they, there's just a lot of questions we have. And so I am part of the DHS Advocates Working Group. So we did formulate a bunch of questions that we wanted to work with DHS on to help them think about how to best approach our clients. So I think and they seem very amenable to working with us on that. So actually having that meeting like fairly soon to discuss those options, I think would be extremely helpful.
I agree with that. I think having the meeting would be very productive in order to get those notices out as soon as possible. And I'll just say, I hope that this is an opportunity for people coming in person to be able to address any outstanding issues with their case right there on the spot, and not just another juncture where more questions will come up and then the questions go unresolved or unanswered. So I really do hope this will be a step in the right direction, but I think in order for that to happen, people need to know that it's coming up as soon as possible.
Okay. I agree with you on that front. I also think too, to the extent that we can prepare people before they go into an interview in person of like precisely what you need to bring with you, I think will help things along. I often think about sort of, trips to the DMV. at least in one particular location, right? They don't even let you get a number until somebody checks to see if you have all of the documents you're supposed to have, and then they send you back home. While that can be frustrating, it does save you time because you didn't sit in the waiting room for, an hour to only get up to the counter and realize you don't have a piece of paper that you needed. But to the extent that there's a checklist on a website in multiple languages that says like, you need this and this and this, bring all of these. And then, a very clear appointment system. I think that could help smooth things over, but we'll continue conversations with GHS and hopefully they can be open to some of the feedback and recommendations that you all made. I don't have any other further questions for you all. Thank you so much for your time. If you haven't submitted your written testimony for the record, if you could just head to the DC Council website and upload that so we could have that for the record as well. This concludes our oversight roundtable on the continued challenges with the DC access system and public benefits enrollment. I want to thank everyone who offered their testimony today and thank the Department of Human Services as well as the Department of Healthcare Finance for their participation. For anyone who was not able to attend or speak at today's hearing, we will accept public testimony until Tuesday, July 16th at 5 p.m. You may submit written statements via the council's hearing management system online at dccouncil.gov/hearings. We will stay on the district on this issue and checking in with our agencies. As I said to the government witnesses, this is hugely important, not just from a financial standpoint, but also just from everyday lives. We don't want folks either putting off their healthcare or unable to afford rent or food or otherwise, simply from a bureaucratic system that can't process on time. And so with that, the time is 1 p.m. and this hearing is adjourned. Thank you so much.